there is so much stigma because most of the times people see you like a walking corpse. When is she going to die? And if you don't die, it is assumed, are you sure she had cancer? I've heard about it and it is not fair. Cancer patients should be given the chance to live.
WHO recommends 300 cancer machines for each country, but Nigeria, experts say, is still lagging behind.
In the whole of Northeast, only one single radiotherapy machine is working at some point. About 60% of Nigerians have to travel for 4 hours to access cancer care.
Experts say adapting a healthy lifestyle and diet with physical exercises and early detection could reduce 30 to 50% cancer cases and prevent up to 30% cancer deaths.
I want to encourage us to live healthy, exercise regularly. Nothing tedious. You don't have to go to the gym. You can go for walks because healthy lifestyle also contributes to a well-being.
Let's avail ourselves to screening. There are screening available. 99% of cervical cancer is HPV related. And this is a virus that can be prevented.
Most cancer issues, experts noted, start at the early age and advise you to live right. Basi Taipa.
Yes, cancer can be prevented with early screening. Let's get started with testing. The burden is real, and to address this, government has provided specialist hospitals across the 6 geopolitical zones to attend to cancer cases. What is the state of these treatment centers? Dalhatu Abdullahi from Sokoto gives an insight on this as he examines efforts of the Sokoto State Government and Usman Dan Fodio University Teaching Hospital towards addressing the cancer scourge.
In many developing countries, cancer tends to present in predominantly advanced stage, partly because of lack of comprehensive screening and poor access to effective treatment. The federal government had, through the Ministry of Health, established and equipped the Department of Radiology and Oncology at the Usman Dan Fodio University Teaching Hospital, Sokoto, in 2010. Provided in the cancer treatment center include multilinear accelerator, a CT simulator, a computerized treatment planning system, and a fully functional mold room. Up to the time when the lifespan of some of the facilities lapsed around 2019, radiotherapy has been the most important non-surgical cancer therapy used on more than 50% of all patients with cancer, whether curative or palliative.
We have adequate manpower, and as I told you now, the hospital management is also making a plan to send us outside the country because of the new machine that is coming very soon. So the two treatments of cancer, that means using teletherapy and using brachytherapy, is in existence in the hospital.
In addition to that, the hospitals in the state are being manned by some personnel that collaborate with the oncology center at Udud, like a specialist hospital Sokoto in the surgery department and O&G departments. The personnel there are engaged in the treatment of breast, colorectal, and gynecological cancers in collaboration with the oncology center at Udud.
The newly inaugurated multi-billion naira ultra-modern diagnostic medical center provided by the Sokoto State Government commenced operation last December is fully equipped with radiological, medical, and laboratory investigation facilities. The treatment of cancer at the Usman Dan Fodio University Teaching Hospital Sokoto is low when compared to other centers, hence the attraction of patients from across the country and beyond.
So I have to thank the federal government for actually considering us to give us a brand new machine. Giving us that means a lot. A lot of our patients, not only within the region, Sokoto, Kebbi, Zamfara, but actually all the patients that we have in the country prefers to come to this Sokoto for their treatment.
We have people that are trained, and these are the biomedical engineers. They have already been trained, some of them even outside the countries, that they have some certain level of competencies to maintain this. This has been a culture of this institution.
Some of the critical challenges include the maintenance of the medical equipment, lack of proper public awareness, leading to the late presentation and detection. However, the cost of treating cancer is becoming extremely high to the low-income earners. particularly the less privileged members of the society. How can treating cancer be made cost-free to this category of patients? I'm Dalhatu Abdullahi, reporting for Deadline 360.
Truly, cancer treatment is expensive. The more reason why we must prioritize early diagnosis. We now go to Enugu, where Chimaroke Ugo reports that oncologists are very assertive that cancer is treatable with awareness and early detection.
Enugu is actually lucky to have one of the 6 centers of excellence as designated by the Federal Ministry of Health, and that is domiciled at the University of Nigeria Teaching Hospital. University of Nigeria Teaching Hospital has been adjudged by the Federal Ministry of Health as a comprehensive cancer center.
Oncologists identified lack of early awareness as a major setback in the fight against the scourge. According to them, most cases brought for treatment had gotten to the advanced stage, which makes the percentage of survival very minimal. They emphasized that early detection of cancer will help in early treatment.
We have to go right down to the level of awareness. We talk about the continuum of cancer care, and it goes from prevention, awareness, education, bridging the knowledge gap. Can it be something that will follow protocols, protocol management, treatment protocol, you know, in order to ensure that there is standardized care across board, no matter where you're located.
The issue with cancer is that the stage of presentation determines the outcome. And so treatment should shift from being institutional-based to community-based dictation.
We cannot have a successful cancer management in this country without government involvement. And the government in recent times have done quite a lot. And an example is the Cancer Health Care Fund.
Health experts identified healthy eating, physical activity, and abstinence from smoking as factors that can help reduce deaths from cancer.
Cancer, like every other diseases, like diabetes and hypertension, are curable when they are early detected. For Deadline 360, Chimaroke Ugu.
If you are of the opinion that cancer is a death sentence, then you need to hear the testimonies of these breast cancer survivors. Let's hear from Lynn Leneke.
The cancer journeys of Dr. Chinenye Okon and Pastor Sarafina were not palatable, but they were determined to pull through. Both ladies have experienced the bitter pills of cancer and various stages of treatment. Today, they are survivors, all thanks to early detection and treatment.
I'm someone that gives health talk, educate women on how to examine their breasts and all that. So I don't just preach it, I also do it myself. And it's in one of those processes. I said, well, I just saw a small change, one color change, a little, okay, which looked harmless because it was painless and all that. I felt this was not there because I know I've been, but why this change? And I decided to do something about it. And of course, I went, took a biopsy and all that, and it came out to be early stage of breast cancer. I went for my surgery, removed it, did histology, which confirmed it, and of course, went through chemotherapy, followed by radiotherapy, and on the immunotherapy.
Unlike me, it was stage 2, and they said to me that, you know, that was at the end. He called me, my husband, to his office, and then he said to us, he said, how many kids do you have? At the time, I just had one kid, and they said they needed to amputate the breast. They have to take off the lump. They had to cut off the breast because it was already fast spreading all over.
Dr. Chinenye Okon, a survivor, says subsidizing the treatment will go a long way in saving more lives.
We need enough cancer centers where people can access treatment at affordable prices. That is the key, because there are some of these cancer cases, you can't avoid it. But when it comes, if we have centers that are well equipped and developed to take care of cancer patients, many people will survive. For breast, you know, some of our ladies, when they have children, they don't want to breastfeed because they don't want their breasts to fall and all that. breastfeeding is also a way of protecting you. It will help you. Okay? So some of those things do help. So we encourage people, those lifestyles, of course, stress is everywhere. You can't be in Lagos and avoid stress. Stress is a major factor.
Don't isolate yourself. Surround yourself with people and loved ones, friends of these people that are going through, such pain. Please be there for them. Just a hello, how are you? You don't know how medicinal, how helpful it will be for that woman.
As the battle against cancer continues globally, Dr. Okon and Pastor Sarafina are adding their voices to those of medical experts to suggest holistic approach to the fight. For Dateline 360, Lynn Lenake.
God at creation gave man herbs and roots for food and medicine. Though medical practitioners advocate healthy diet for quality living, how effective is nature's medicine in the treatment of cancer? Fatima Usman, in our next piece, takes a look at the place of herbal medicine in managing the disease, as well as the possibility of curing the ailment using herbal remedy.
Cancer is dreaded not because of itself, but because of its consequences. One of the consequences is that when it wrecks the immune system, the entire body is now disposed to all forms of sickness. Once the immune system is no longer functioning fine, then it can no longer defend the body. Even a small mosquito bite that should have been defended will result into malaria. This semolina, if you take any virus, it affects almost all parts of your body. Another thing, again, that creates a lot of trouble when there is cancer is the fact that this tumor will deny other parts of the body oxygen. Because of its size, it now corners every oxygen that comes into the body. Once that is done, other organs will not function fine because they are not supplied with enough oxygen.
Factor that slims the chances of surviving cancer in Nigeria are late diagnosis, the beliefs, and above all, cost of the limited treatment available. This reason is no doubt among ones that have made patients of the said ailment to seek alternative in herbal remedies through traditional medicine. Abdurrahman Majebariki, who claims to be a survivor of cancer through the use of herbs, gives account.
Hospitals say they state time to do operation for me. They use local medicine.
Another survivor, Nura Abubakar Wowo, also recalls his encounter with cancer.
He started 1991 to 92. So to raise my hand, I couldn't raise it. My hand is heavy, swallow, paying me. He said, no, it's a cancer. I went to the hospital for the X-ray. They told me that they will do the operation, open the place. After they open the place, they will just scrape the bone. The disease where they top of the bone, they will scrape it. Then they will. So since that time, we never go back to the hospital. I take so many this thing, but are there many arms too?
I cannot count the number of people I have cured of cancer using plant and herbs.
Wannan da ciwon daji duk kuma sun samu waraka.
Yanzu a kimance ne a duk wata a kimance ne a zuwa magani a nan.
Every month I cure up to 20 people, and in 3 days you will see difference. If not, I discharge the patient to seek alternative.
Then use this mixture of black seed powder mixed with honey and continue to rub it. Don't worry, when you start it, you might not see anything. But from 21st day, you begin to see it's going to dry. The water coming out of it will reduce. The smell will equally go. And you are going to do it for 6 months. But it can be discouraging if you are not informed, because you'll be putting it, you will not see any major difference. Next thing again you can do is to first thing in the morning, take olive oil. But look for the good olive oil. When you go there, ask them for the one that you can consume. So you can use that one to treat yourself. Then you drink 1 cup of boiled purple leaf and 9 seed. You look for purple leaf, you boil it and take one small cup.
He also maintained that since the dreaded condition has an hereditary trait, research have also shown that the cycle can be broken using herbs.
Cancer is no longer a death sentence. There are several herbs you can use. Common mimodical balsamic, what is called garafini. Even if you have it and you take 1 cup for 6 months, the good thing about it is that it will not spread. It will empower you. It will recover your immune system. And once you are able to get your immune system in order, cancer will not do you anything. And so one of the treatments we give once you come is to make your immune system become effective again.
Medical experts, however, say these claims are yet to be verified. In Mina, I am Fatima Usman.
Our next port of call is Jigawa State to ascertain procedures and claims of herbalists in providing alternative treatment and cure to cancer. Mohamed Askira interacted with some of these herbalists and cancer patients who share their experiences on the efficacy or otherwise of this treatment.
To find out, NTA Dutse News crew traveled to Brunikudu local government area of Jigawa State, a home to one of the herbalists, Suleiman Mohammed, believed to be one of the best in the states in the field of alternative medicine. Cancer, popularly known as Ciwon daji in Hausa language, he says, is a long-known disease among the herbalist community all over Nigeria. Malam Suleiman Mohammed seemed to be good at his job of providing alternative treatments and possibly cure to many diseases, including cancer. I asked him whether he truly has treatments and cure for cancer. He smiled and simply placed a phone call to one of his former patients and asked if she was once treated of cancer, to which the answer was affirmative. He went on to list types of cancer and says cancer is usually triggered by some conditions presenting a few unknown symptoms until it explodes.
Medically speaking, cancer is one of the difficult to treat diseases, as it is known even in the conventional medicine. But we have our ways of identifying cancer and treat it accordingly. It's triggered by something else, such as injury to a part of a body, or even food we eat and liquid we take. Cancer is of different types and manifestation, and we have varieties of herbs, roots, and other forms of medicine to treat and cure a patient with cancer. I have treated a number of patients in my close to 40 years in this business.
Suleiman Mohammed is not alone in this field of alternative medicine. Alhaji Tasiu is another experienced one. They both confirmed curing of more than a dozen patients of cancer who were on the verge of being amputated in various hospitals in Jigawa and Kano states. NTA News crew could not reach most of them as they live in faraway local government areas and the neighboring states.
In our investigation, we have come to realize that if a person is feeling heat in the body and feels like something is moving in him while nothing is actually seen on him, then there is high tendency that such is a cancer, because if he or she sustains injury, cancer can be triggered. This is apart from other underlying health issues that promote cancer. We have our ways of investigation, treatment, and cure of the disease.
However, the crew is lucky to meet a 50-year-old Zainab Ahmed, a mother of 5 who spent more than 3 months on hospital beds and was told to lose her leg through amputation at Murtala Muhammad Hospital in Kano before she was saved by Suleiman Mohammed through his alternative treatment. Zainab went emotional when narrating her experience with cancer. I never thought I could walk on my feet again, she said.
I was told I cannot be cured until the leg is amputated. I have taken so much injections and other forms of medications at the hospital. But after I rejected being amputated, I was informed about this man. It took me less than 3 weeks to get cured of the cancer. I cannot thank God enough, and then Muhammad for the cure.
Cancer, these herbalists say, does not occur on its own. It is the result of the dietary habits of the patients, and traditional medicine provides an alternative cure and treatments to all kinds of cancer. Suleiman Mohammed took the NTA News crew to one of his garden of herbs, where he grows most of his expensive and hard-to-get herbs for the concoctions of traditional medicine. These herbalists have more than 40 years' work experience in the field of traditional medicine. They say they are working in close rank with medical consultants from hospitals and researchers from universities across the country.
We work with the hospital together where necessary, but where that does not work, we do our best to save life, even if we disagree with them, and most times they thank us at the end of the treatment.
If
we ask a patient on how he or she feels, then we know that this is a patient of cancer, and based on the investigations, we know what medicine to give to the patient, and thank God we have been successful in doing this for long.
People from within and outside the area are trooping in to consult them on treatments of various ailments, and many are leaving satisfied after the treatment procedure. From Dutse, Muhammad Askira for Deadline 360.
We hope for greater collaboration between researchers and herbal practitioners to help reduce the cost of treatment and ease the pain of patients. I am Omotola Mojola. On behalf of the production crew, I say thank you for your time and God bless Nigeria.
Don't forget to send in your messages.
That's a different.
Hello and welcome. This is NTA Tuesday Live and I'm Cyril Stober. The federal government within the week signed a memorandum of understanding with the National Health Insurance Scheme, Federal Road Safety Corps, Association of Private Medical Practitioners of Nigeria, Guild of Medical Directors and the FCT administration. Now, this is to facilitate the delivery of emergency medical service along three operational paths: coverage of highways and roads, coverage of emergency within states and the Federal Capital Territory. And this is to meet rural community needs in areas of maternal and child health, especially at odd hours. NEMSAS is the operational arm of the third disbursement gateway designated in the National Health Act, with percentage of the Basic Healthcare Provision Fund for Emergency National Medical Treatment. Now, the World Health Organization describes the move as a solid foundation for a functional emergency system for effective service delivery at federal and state levels. Tonight, NTA Tuesday Live will look at some of the prospects in the new drive to contain emergency health issues involving domestic, workplace, assault and sports incidents. But first, let's get to see this report put together by health correspondent Basi Taipang.
Emergency medical and ambulance service provides response and medical transport for millions of sick and injured persons who oftentimes are caught up with their fate. It reduces morbidity and mortality in disaster and mass casualty incidents. The goal of emergency care is to get people safely into the hospital. The service involves prompt response to medical distress calls of all types, with first responders and assured first aid at the point of care at no immediate cost.
What it means is that if there's any accident by the roadside or any complication, the emergency ambulance will resuscitate that patient and now will take the patient to a referral center, be it a primary health care or secondary health care. The overall aim is that this attempt is going to reduce morbidity. It's also going to reduce death due to accident and emergency by the roadside.
In Nigeria, ambulance services are executed by individual hospitals, public and private, as well as organizations and agencies, making the service either inaccessible or expensive to access. To reduce the number of deaths caused by the delay in access to healthcare services is the reason for the signing of the memorandum.
NEMSAS is an essential ecosystem towards disaster risk reduction and governance for the health sector.
And I assure you we will host the pilot scheme and work very closely with you so that it can be expanded to all parts of the country.
The availability of these essential services is also needed to combat harmful traditional practices and strengthen the decision-making power to seek appropriate health care. The service pathway is to be managed by a number of highly trained professionals. The Federal Ministry of Health relies on many organizational partners to perform these service delivery functions effectively through a mix of public and private sector healthcare providers. Basi Taipa, NTA News.
And that report set the tone for tonight's discussion. Let's start off by introducing our guest to you. We'd like to welcome to this program Dr. Felix Ogedegbe. He is Chairman, National Emergency Medical Treatment Committee. Thanks for joining us tonight.
Thank you very much for inviting me.
All right. Let me also welcome to this program Dr. Saidu Ahmed Dumbulua. Is the National Program Manager, National Emergency Medical Service and Ambulance System, NEMSAS. Thanks for being with us tonight on NTA Tuesday Live. All right, let me also welcome to this program DCM Joshua Kehinde Fanola. He is a Deputy Corps Marshal in charge of operations of the Federal Road Safety Corps, FRSC. Thanks for being with us tonight on NTA Tuesday Live. Well, as we always do every Tuesday, we acquaint you with the procedure of the program. At some point in time, you can get to be part of the discussion in the studio. We'll remind you when that time comes. That's when the phone lines will be open and you can call in and raise issues, questions, or make a comment on the issues at stake. But tonight, it's all about National Emergency Medical Services and Ambulance System. At that appropriate time, we'll keep you posted, we'll refresh your memory and acquaint you once more with the procedure. We do this every Tuesday. So, welcome to NTA Tuesday Live. Once again, let's start by finding out what actually is the National Emergency Medical Treatment Committee, what it's all about, and we turn to the chairman for that, Dr. Felix Ogedegbe. Let's hear it.
Yes, thank you very much for having me here. It's my pleasure to be able to throw some light on what the National Emergency Medical Treatment Committee is all about. If you go back shortly in the memory lane, the National Health Act was passed in 2014. And there in that act was placed a provision to be sure that some of the money that was set aside for the Basic Healthcare Provision Fund was actually appropriated to be used for emergency medical treatment. And this is against the backdrop of the understanding that a lot of Nigerians have suffered ill health because they have not been able to get emergency care when they needed it. Like you know, emergency care is time-bound. If you don't get care when you need it, then that becomes an issue. So from 2014, when the National Health Act was passed, that provision was placed, and in to 2019, the National Emergency Medical Treatment Committee was inaugurated. This committee has been placed to carry out a twin mandate. One, of course, is to operationalize the percentage of the Basic Healthcare Provision Fund, which is to look after emergencies, And side by side that a fused twin mandate, which is to make sure that there is a national emergency medical service and ambulance system to be able to provide a system of structuring all the emergency services in the country and make sure that Nigerians have emergency medical care becoming a vital part of the healthcare delivery in the country.
Who are the medical personnel and where are they drawn from, and is there a pool, or who contributes to it?
So one of the wonderful things and the approach that the NEPSAS project led by the NEMTC has done is that we're actually leveraging on resources that already exist. And you would know, for instance, that healthcare in Nigeria is provided both by the public sector and the private sector. So public sector and private sector have come together in a harmonious way to be able to provide them emergency medical services to Nigerians. So we expect that all ambulance service providers and existing hospitals that have ambulances are all going to be put in this pool to actually form what we will know as a pre-hospital service, which is the part of the emergency medical service that picks patients up from the point of injury or the point of acute ill health and actually take them to the point of need, which is now the acute care centers. So you have this twin arrangement, and they're going to be provided by existing, and we also expect that people will then become interested in investing in these areas of care, because, like you know, it's quite it's not a usual type of care available in Nigeria. I mean, if you go outside this country, you know of the 999 systems, 911 systems, and 122 system. You know that they already exist and people know how to get care, but we want to make it a household feature here, and we're going to bring in, you know, various players from the public sector, the private sector, and even charity organizations are going to be contributing ambulances and resources to this care.
All right, we'll come to other aspects of it for later on in the program. And let's go over to Dr. Saidu Ahmed Dumbulua, who's the National Program Manager, National Emergency Medical Service and Ambulance System, NEMSAS. So it's the same thing we'll put to you. Tell us exactly what NEMSAS is, how it operates, and how it will work.
Mr. Cyril, as the acronym says, that NEMSAS, National Emergency Medical Service and Ambulance System, is an innovative program that actually came up in a bid to address the missing link in the Nigerian health sector. We all know that we have three tiers of healthcare in the government, in the Nigerian health structure. We have the tertiary, we have the secondary and the primary. But we realize that it's something that is missing, because if you happen to come from a very ruralized area whereby there's a problem of transportation or issue related to financial access to actually pay for services, you understand? They know who's going to pay for that. And that has actually contributed to the ever-increasing maternal morbidity and mortality in the country. So that missing link is that transportation using ambulance services and actually paying for the services for that. So once we have that national emergency medical services and ambulance system, that program which is innovative, and it's also going to be the real organ that is help in the implementation of the basic healthcare provision fund, where 5% of the 1% consolidated revenue that is given to the health sector, 50% is given to the National Health Insurance, 45% to the National Primary Healthcare Development Agency, and that 5% that is given to the basic health to the EMT gateway, that is this NEMSAS, under the supervision with the supervision of the NEMTC, is going to be used to actually to save the lives of the vulnerable, downtrodden, indigenous Nigerians in the country. And this one will dramatically change the narrative of our dismal indices in terms of the healthcare delivery in the system. It's an innovative, it's a new concept, you understand, and we are very optimistic we'll get there. And the way it is going to operate it is that it's through three operational pathways. We have identified, we have signed an MOU with some of the very critical stakeholders in the country, such as the Federal Road Safety, such as the FCT administration, and also the rural. So the three basic operational pathways are as follows. One, the federal highways and the roads, where we're going to engage the services of the Federal Road Safety, where now Federal Road Safety is not going to be doing only a road traffic response. Rather, when there's an accident, they'll only be called. No, once you call them, even if it's a medical emergency, surgical emergency, then they'll be able to actually dispatch their ambulance to go and pick that patient from wherever the patient is and pick to the nearby public or private health facility accredited, you understand, and that person will be attended to at no cost to that person. It's a fee for service, but a kind of remunerated by public service initiative. That means somebody is going to pay for the service, however, it's going to be free. The government is going to pay for the service, but it's going to be free to that patient. So once the person is actually taken to any nearby facility, private or public, the person will be actually attended to for the first 48 hours at no cost to the patient. And this will involve both the ambulance, the rural, the boat ambulance, the tricycle at the rural area. For instance, if you are from the ruralized settlements, so to say, trying to actually get access. Most of the time, the hard-to-reach areas, you can't even use the ambulance. Or maybe you're in the creek or the riverine area, you must have a boat ambulance. So we're also focusing on that, diversifying all the ways in all ramifications, all as part of the effort to see how we are going to scaffold the health system in the country. It is very important. Some may actually think that we are kind of in a headlong push to enemy, but so to say we are not. We are actually following the standards that is expected of us to put everything in place in a bid to attain the desired goal. And being is a new concept, you understand, there is a need for a kind of a collective understanding and to come and work together in the spirit of inclusiveness, so that we'll be having a kind of very definitive deliverables that we're supposed to actually attend, so that we'll not be like a desert cloud moving without a definite destination. So I'm very optimistic. We have come, the MOU have signed is to symbolize that, yes, NEMSAS has actually come to stay, and we're actually going to operationalize it, you understand. And soon we are going to roll out in a couple of weeks in the FCT administration, and FCT has actually given us all that it takes for us to actually work with them to ensure we operationalize. How it works is that if there's an incident, be it a domestic incident, medical emergency, surgical emergency, geriatric emergency, whatever kind of emergencies, you call 112. The 112 is a toll-free number that is actually been provided by the NCC, manned by NCC, owned by NCC, provided and managed by NCC. It is owned by, however, it's a free kind of services, public service. You call 111 wherever you are, whether there is service or no service, you understand, that 112 will get through to the what? To the NCC. And now NCC will drop the call to the nearby, will relay the call to the nearby states, whereby there's a facility, public or private. We search for an ambulance, either using COG or any of the software that is available to search for the ambulance. Now we actually deploy the ambulance to the scene for an accident. So that is how the operation is. A new program that is coming, that is actually unfolding, and a lot of things as we are going.
Yes, Dr. Dumbulua, let's get it straight. Talked about, obviously, communications is extremely critical in this service. You talked about calling 111, 112. What is the emergency number here? 111, 112.
The national emergency number for Nigeria, toll-free number.
Yes, it's extremely important to keep repeating this, because as you well know, until only recently, a national call center didn't quite exist, and many people were still thinking about what used to happen in the old days. You talked about 999 in other parts of the world, 112, but let's keep repeating this so the message can be driven home to the general public that there actually is a national emergency call number and it works. So give us the numbers again.
It's 112, and honestly, we must commend the National Communication Commission for what they have done. At the moment, according to the data we have from them, they have covered almost 24 states. 24 states in the country actually have the 112 functional at the moment now, and they're actually trying to increase until you cover the 36 plus FCT in the country, which is critical in terms of the coverage, the total coverage of the country as a whole. So 112 is the number, and it's still functional. You understand? Only that we have not started rolling out, even though the Road Safety are actually using it, part of it, to actually do some of their own activity at the moment, which they are also doing a very good work. What is interesting is that the Road Safety itself also, you're going to hear from them, but they have also done well, and we're also going to work with them to see how we're going to achieve the expected deliverables of us.
Okay, fantastic. The Deputy Corps Marshal in charge of operations is here with us on tonight's program, so we go straight to him. And what we'll start off with, DCM Fanola, is the state of emergency response in Nigeria today, as the Road Safety Corps. This is one organization that has had to face challenging situations in terms of emergency, particularly in the highways, rising from road traffic crashes and all that. So tell us the state of emergency response today.
Okay, thank you, Cyril. Thank you for the comments about the challenges we face. Well, that is what we are paid to do, and we are up to the challenge. We have, of course, we all know that the essence of the Federal Safety Corps is to prevent crashes. But we all know that because of the issues that has to do with the driver, that has to do with the road, that has to do with the vehicle, some crashes will still happen. So when they happen, we have a responsibility to ensure that the crash victims are rescued and professionally, and then transported to medical facilities, the closest possible medical facility professionally. We have been doing this since inception, and we have learned on the job, and then we have improved in our skills, we have improved in our network, we have improved in the volume of facilities that we have. So as it is today, I can assure you that within the major cities, we can render rescue services within 10 minutes of occurrence of a crash, and on the highways within 15 minutes. Within the FCT, we have 11 ambulance points, and sometimes we will be able to respond in less than 10 minutes. And generally, the public are getting used to the national emergency number 112, as my colleague just mentioned. But before then, FRSC had developed a national emergency number 122, which is also still operational, and it has been subsumed in the national emergency number. So those call centers that were established by the NCC, we have our desk officers there, just like we also have some other agencies with their desk officers there. So when it has to do with road emergency, the call will be diverted to FRSC, and then our nearest ambulance service will respond to that. So as it is today, we have about 120 ambulances strategically located along the highways in Nigeria and within urban centers. Without any spirit of immodesty, I want to say that is the biggest, that is the largest ambulance fleet that we have in this country. And we are still counting, we are still improving on it. Within the FCT, I told you we have 11 points, and out of these 11, 5 of them are actually advanced life support ambulances. We can deal with any emergency. With what NEPSA is doing now, they want us to up the game by including certain things that we're not doing before, because now they want us to also be able to respond to some other emergencies that are not road emergencies. So I believe that with what NEMSA is trying to do, Nigerians will have better services from us and also from NEMSA.
All right, okay. Well, we'll return to you in a short while. Just to mention that in addition to the guests we have here in the studio discussing the issue at stake tonight, we also have a number of reports from our centers across the nation. We might just as well begin to take some of these reports, starting off with this one that is coming from Lagos by Ruth Samuel.
Increasing urbanization and industrialization of Lagos State has led to an appreciable increase in the number of road traffic, industrial and marine accidents, as well as emergency responses. Currently in Lagos, ambulance services are executed by individual hospitals, private and public, private organizations, and the Lagos State Emergency Management Agency, LASEMA, and the Lagos Response Unit, established in 2001. The policy by the federal government to introduce the National Emergency Medical Services and Ambulance System in the country, particularly in Lagos, is seen by many as a welcome development, as it will assist in strengthening the existing pre-hospital services available in the state.
If there's a proper EMS system as proposed by the government, you will see that ambulance goes to them, the right providers goes to them, they treat them right there on scene. Everything that is found in the ARO is found inside the ambulance. You treat them in terms of equipment and manpower, you treat them and you transport them to the hospital. So the rate at which people die will not be much as before.
Ambulances are more like mobile ICUs. ICU means intensive care unit because they contain quite a number of life-saving and life-sustaining equipment. Like you have the defibrillator, which helps to bring patient back to life in case of sudden cardiac arrest.
Competent hands will be hired. Of course, the private individuals mainly are into business to make profits, but government is more like providing social services to the people. So competent hands will be hired and at a cheaper rate.
As a densely populated state, Lagos prides itself as a city with the most gridlock in the country. Respondents are of the view that for the full implementation of the National Emergency Medical Services and Ambulance System to be effective, the peculiarity of Lagos must be taken into consideration.
That may be a big challenge, but I think that is part of what should be incorporated into the planning before implementation. So rather than have just one center, where you have the medical emergency, it can be distributed. So you would have one on the mainland, you would have on the island.
So in cases like that, there are ways around these things to help. If government can make BRT rates available and create more where they're not available, to give easy access to these ambulances so that they can move from one facility to the other.
Lagos residents are optimistic that the federal government intervention in the health sector will to a large extent support the overall socio-economic development of the country.
All right, that report by Ruth Samuel from Lagos. Next report comes from Maiduguri. It's by Pauline Vanna.
Ambulance with capability to reach emergency scenes within shortest possible time after distress calls contains drugs and life-supporting medical apparatus to stabilize ill or injured person while being rushed to the hospital for proper medical attention. These services, which is slow in Borno due to insecurity, lack of enough ambulances, and emergency call control center, have led to high morbidity and mortality rate in the state.
By the time we have this system on ground properly established, that will go a very long way in reducing morbidity and maternal mortality and even the general mortality, because most of the cases comes sometimes as an emergency, most especially in the rural areas. So they will have the opportunity of accessing this code and accessing these ambulances.
However, amidst the COVID-19 pandemic, government and humanitarian partners procured more ambulances and distributed to hospitals, which is still in use for all categories of emergency cases.
There must be an ambulance policy before you key into that ambulance policy. Currently, I said there is no ambulance policy. 99.9% of the citizens don't have contact with the hospital, so in case of emergency, they hardly call for ambulance.
To key into the modern healthcare services, a member representing Jere at National Assembly, Engineer Satomi Ahmed, procured and equipped 4 vans as mobile clinic, rendering effective house-to-house and referral services, in addition to creating awareness and sensitization on healthy living.
We are not doing that as serious intervention due to the regulation, due to the expertise and how
but we have all what it takes. They're working, and it's giving a lot of intervention, particularly to those in the villages.
With the introduction of the National Emergency Medical Services and Ambulance System, the experts are optimistic that healthcare needs of the people will be provided on time and efficiently, even though the workload will increase in view of the emergency calls if quote number of control center is made available. Certain health situation requires emergency care. Availability of these essential services will no doubt make people responsive of their health status, thereby reducing morbidity and mortality rates.
All right, that report from Maiduguri. Well, let's come back to the studio here and begin to look at those things that might stand in the way of getting the system up and running the way it should be. And let's examine this with Dr. Ogedegbe. It's a known thing in this country that let's even start using road traffic accidents. You see the police transporting injured, sometimes corpses from accident scenes, using pickup trucks, open pickup trucks. That happens all the time, all over the country.
That's correct.
Another scenario is someone needs emergency attention. They approach a hospital and they're not treated unless they have a police report. Now, this is in spite of the fact that many times it's been put out that you provide the care first, it's still not working. Even recently, there are reports of injured people who have been refused medical treatment because of the absence of a police report stating what happened. How do you go about all this?
Yes, thank you very much. You do have very important points in this, and what this brings to the fore is that there's a lot of public enlightenment that people need to know. The introduction of an ambulance system like NEMSAS actually provides an opportunity to have a different approach, a paradigm shift. A lot of people need to be educated on how things are and how things should be. Unfortunately, some of the more advanced parts of the world have left us behind in terms of rendering an ambulance and emergency medical services. But this is a novel approach. This is a bold approach to be able to help us to catch up to how things should be done. So you do, of course, realize that most people associate ambulances with dead bodies. They think that if you see an ambulance carrying somebody, then the person might have died. Whereas, actually, ambulances are meant for the living.
Well, that's easily because traceable to the fact that people do not make the difference between a hearse
and an ambulance. Exactly. So a hearse is not an ambulance. An ambulance is actually kitted, properly fitted to ensure that people can be kept alive. So when you see police, like you said, carrying groups of corpses in a vehicle that is not suited to carry people like that, of course you might also say that it's because the ambulances are not available in the first place and they are not deployed to where they are needed. So we are working with the road safety and with all the other players, like you just mentioning the example of the road traffic accidents. We're working with them to ensure that the response time for ambulances to show up is cut to a minimum, that people actually get help. And then, of course, when you then take the next point, which is you're taken to the hospital, will there still be any justification for any hospital or medical practitioners not to attend to injured victims? Let's even include gunshot injuries to those. There's already a law in Nigeria that says that you must attend. And that law was actually passed because there was that fear, and people said you have to get a police report and all of that.
Are not going
and I'm glad that you are putting this on NTA News, because it has to be put out there again and again that in Nigeria, hospitals and healthcare workers and medical practitioners are bound by law to attend to wounded and injured and people who are ill, even when they are gunshot injuries, without first demanding for a police report. And this works in multiple ways. Perhaps the police force too have to be properly enlightened, so they don't go asking people why they didn't see a police report before treating somebody who is ill. And I give you this situation. When you see somebody who is ill, who is injured, or who's been shot, you don't rush him to a police station. to get a report. You rush him to the hospital to get care. And so we are now trying to provide a bridge here that instead of individuals rushing your personal vehicles and not treating in the process, the availability of ambulances means that people who are so injured have treatment on the scene, and they have treatment in transit, and they have treatment in hospital. Because if you only rely on treatment in hospital, then you can't imagine, no wonder when you look at the indices from the WHO, that the number of people dying from road traffic accidents in Nigeria is abysmally very high. It's not something we should even be proud of at all. And that is because people don't get care at the site of the injury, and they don't get care at the scene. And very few of them actually get to hospital in any shape or form that will allow the hospital to be able to treat them. So we do believe that with public enlightenment like you're doing now with programs like this, that individuals who actually understand what they should expect, that healthcare practitioners understand what their roles should be, and they should understand that that role is unhindered. The laws of our land are very, very clear on this point, that you don't first ask for any form of reports before you treat. And then we're adding that point, which is also what we found by experience, that you then get to hospital and then they say, where's money? You haven't paid, there's no money in your pocket. You went out of the house, you didn't plan to have an accident, and you didn't plan to slump. So how do you get money to pay for immediate care? And we do know that there are people who have died, even though they were very rich, but they didn't have money or they couldn't provide money at that point. So the NEPSAS program is providing, and that is where all of the stakeholders came together to sign the MOU. And part of what is written in the MOU there is that you're guaranteed, the federal government of Nigeria is giving you a guarantee that when you treat people where they're not able to pay, you'll be paid from the fund. So that's also one other area that people should have some comfort about, and the law enforcement agents must know that they cannot and should not harass any healthcare practitioner that treats any injured or any gunshot injured patient without any police report or any such documentation.
Okay, this next question, I think I probably would just give it to Dr. Dumbulua. I think it was Dr. Dumbulua who spoke about accredited hospitals and health institutions. Now, let's start from knowing who are those who are accredited, which hospital, how many have you been able to, agree with who are accredited? I'm asking this because, again, it's a well-known fact. People needing emergency services are rushed to hospital, and they are rejected. One, for reason of no bed space. Two, payment. Dr. Gedegbe just started talking about it. Somebody has to go, and we've seen patients who are in dire need of help, and they're kept there because somebody has to go and acquire a card and pay for a card. And before they go around and start looking for, well, are you going to pay for a consultant or to pay for that? I mean, things like that happen on a daily basis. People are rejected. So that is one aspect of it. Now, how are we going through with this? As large as Nigeria is, the hospitals that are accredited, and will they carry any insignia to show that this hospital is accredited, and may not just reject a patient for so many reasons, which will unravel in the course of this program?
Mr. Cyril, is a very good question. And if you look at it from that perspective, is that, as I said earlier, a couple of days we signed MOU with the National Health Insurance Scheme. The NHIS, in fact, have the database of all the accredited hospitals nationwide with their cognates. And they know where exactly the hospital it is situated and where the positioning of that hospital is. And we're able to actually get the database. We've signed an MOU, we have actually gotten a database, we know exactly where the hospitals, all in Nigerian, public and private, accredited by NHIS. So, for instance, because now we are starting with the pilot FCT, a pilot state as FCT, we have all the accredited hospitals in the FCT, and we know we have the allocation with the help of the NHIS. And if you look at it now, the engagement of the private sector, hospitals, accredited private sector, is just like kind of expanding the bed space. You know, the issue of the bed space syndrome, whereby that we don't have enough bed space, you take a patient to a place, no bed space. Now by actually allowing the private sector to come into the kind of the engagement or kind of a partnership, so that means we have increased the bed space. So if you go to a government hospital, you understand, there is no bed. And if you go to the private, there will be bed because they are looking for money. It's a kind of a business activity. So we are expanding the bed space syndrome, which is critical also in terms of saving, which will solve the issue of the delay, which is one of the factors that actually increase the morbidity or mortality, especially of the maternal mortality that's happening in the country, and even the under 5 mortality, which is actually claiming hundreds of lives every day in the country. So this is basically what we have. We have the list of the accredited hospitals so far now, because we are rolling out, and the rollout is going to be staggered, you understand, in one state after another. For the FCT, we have it, and we're going to start with FCT in that matter. And the issue of the base space, rejection, and other things, because we have expanded the potentials of having more base space, so it's not going to be a problem again. So that is basically what we have, and we're very optimistic it's going to work. And the issue of the rejection will not be a problem at all, because it's going to be a kind of one-on-one business. We are going to pay, we have the funds to pay the private sector.
Yes, Dr. Gedegui, you're going to come in here.
Yes, just to add to what Seydou has said, you do realize that what has happened in the past, again, trying to shift away from the past and going into the future now, is that you have to get to the hospital, and then you're told there's no bed space. So you get to hospital A, and then you go to B, and you go to C, and you go to D. What the NEMSAS is proposing, it's a software environment. It's run by communications. You know, so people are talking to each other all the time. So the accredited ambulance service providers are talking to the hospitals as well. So they will have to call the hospital, and if the hospital says, we've got 50 beds, they're full, hospital B will say, we have space, they will bring. And hospital C will say, we still have space. So they don't need to first go there to not find that there's no space before they go to other places.
I'm excited about this MOU involving critical stakeholders, particularly the NHIS. As you do know, one of the biggest challenges, in the next few days, we might be bringing this to the notice of the NHIS as well. One of the big issues bedeviling the NHIS, at least for a while, was that there's argument between HMOs, and now you are into the system where treatment should be provided free of charge. Someone's going to pay for it, but it's free to the person needing that emergency service.
Yes.
On the grounds that an MOU has been signed, that whatever is expended, whatever is incurred in treating the person needing emergency services would be paid for by the government.
Yes.
Now, it has not worked that way on so many fronts, and Nigerians are looking out for a real change from what used to happen in the past, because it's taken so long, and yes, we started a new system and we're still not caught on it the way it should be. Now, this is adding a different dimension. Yeah,
absolutely. Yes, and we think this will work because of the approach that we've taken. So you would know that whilst some of the hospitals accredited by the NHIS are struggling to cope with patients, there are others who don't have enough patients to see. So here we've dimensioned a lot of monitoring and evaluation into what we're doing, such that if you get 5 patients, you manage to treat 4, then you're probably not going to get more. And there are other players who are willing and able, and actually now setting up, by the way, there are new private emergency ambulance services coming up even in Abuja and in Lagos right now. So they're waiting, because they're going to be paid for this. It's not for free. It's not a 1-month subvention and that's it. You're going to be paid on the basis of the work that you do. So we are going to be monitoring the providers. Good. So that those who are not able to provide care for the patients we send to them, they'll probably not get those numbers of patients, or they will not get any patients at all. And those who are able to demonstrate an ongoing ability to provide care for patients and not turn them away and not say that there's no bed and there's no that.
Provide adequate care.
Adequate care, absolutely.
That's commensurate with the payment they're receiving.
Yes, absolutely.
The aspect of monitoring, we will explore
on an agreed
that.
tariff, yes.
Right. We'll explore that monitoring bit much later. But let's come to DCM, Kehinde Fanola. Yes, You have just said you have the largest fleet of ambulances in Nigeria, 120. We're talking about a population of here of how many million? 120 ambulances. Yes, it's a good start, but still room for lots more. Now that you're keen into the NEMSAS and being a critical stakeholder, now, at what point will FRSC now get involved? You said earlier on that there are some other non-road crashes situations and emergencies that NEMSAS would want you to get involved in. I'd like you to tell us about those and, and how that would affect what you do provide at this point in time.
Okay, thank you, Cyril. I said earlier that we have the ambulances mostly on the highways, but we also have them within the cities, and I specifically mentioned that within the city of Abuja we have 11 ambulance points, and I also said that of these 11, 5 of them are actually advanced life support ambulances. Now, with the establishment of NEMSA, we are being expected to up the game by getting involved in certain other emergencies that are not road emergencies. For instance, maybe obstetric cases and other cases like that. These are likely to be within the urban centers, not on the highway. So while we maintain our ambulance points on the highway, because that is where we actually have very serious crashes that sometimes you find that many people are involved at the same time. So our effort on the highway is such that we have data that showed certain areas that are prone to crashes. We call them black spots. So the ambulances are placed there. Then when crashes happen, we also have a database of hospitals, both private and public, that we can easily take people to. Then I also want to correct the impression that is being created about hospitals rejecting patients and things like that. Well, it doesn't happen when FRSC is involved. Hospitals, either private or public, they know that statutorily FRSC has the mandate to carry out this rescue, and they know that we'll be able to get the relations, the relations of these crash victims. So sometimes, well, FRSC also go one step further. If they insist that we should buy card, we do that, and then at the end of the day, we'll make sure that that patient is attended to. But I also want to say that with the communication that we have now, especially the 112 and the 122, we are also able to communicate even with the hospitals before the crash victims are brought to them, to let them know that we are coming with crash victims, and then we'll be able to give description, the number of people and the nature of the injuries. Then the hospital emergency units are already prepared even before we get there. These are situations that are on ground now that helps to ensure that we do not lose lives unnecessarily. And also that communication is becoming popular. People call the call centers, both the FRSC call center and the National Communication Call Centers, telling us that a crash has just occurred. Sometimes it will be something very minor. By the time we get there, you even see that the persons involved has even walked away. But it shows that the Nigerian public, they are becoming conscious of it. Sometimes people want to check, they want to try, is it true? Does it work? Then they will just call and say, somebody just collapsed here, come to a beggar roundabout. And in 10 minutes, an ambulance has come. So that is where we are now. And I told you we have 120 ambulances and still counting. The present administration has done so well. They have renewed the old ambulances we have, and then we are getting new ones. So I believe that, yes, Nigeria has a population of over 200 million people, but I think these ambulances that we have and the personnel and also the other facilities, because we still have roadside clinics in addition to these ambulances that we're talking about. I believe it's a good starting point for us, and we're improving in terms of quantity and quality, and I believe the average Nigerian road user and average Nigerian citizen will be the better for it.
Personnel, that's a good place to go to next. And because we're talking about emergencies here, and training is key. Not all those who would be responding to emergencies are medical practitioners in that sense. There are those who provide all the services. So training is key. Even for those that you need to treat on the way, you still need a group and crop of dedicated and highly trained personnel who know what they're doing. What is the status here? I'm looking at it. The second part I'm looking at here is with the general shortages everywhere, inadequate staffing in health institutions, health professionals are in short supply. This is real. How do you cope with a system like this that will require more health personnel?
Yes, thank you very much for that. I think it's some of the reasons why we're doing what we're doing, actually to close those gaps. You will realize that even though the ambulances we have right now are few, they're actually manned by doctors and nurses, and that's not supposed to be. There are a crop of professionals who are called emergency medical technicians or paramedics who are already being trained in Nigeria. But because the concept of ambulance care has not been popular, they don't find jobs. But they are the ones that actually are supposed to man the ambulances. They're trained to scoop, they're trained to rescue, they're trained to treat on the way, and they're trained to be able to communicate to where they're going, and they're trained to give essential life-preserving treatment. And I dare say that there are actually several, some of the schools like the University of Benin Teaching Hospital have been turning out these trainees, these graduates for some years, and they've not been employed.
If you were to assess the numbers of these professionals,
yes.
What figure would you be looking at? And if you're starting a scheme like this, obviously you'd do an assessment of what you have available and what are the gaps that you need to close.
Yes, we've actually done an assessment, and we see that the figure of people who've already been trained now about 500, which is quite small when you compare that to the population of Nigeria. But more schools are opening up to train them because we must all understand that the ambulance, emergency medical service, emergency medical care, it's a big industry. It has its own equipment, it has its own trained personnel, just as I'm saying. We will expect that doctors and nurses will be in hospitals working, and these EMT guys will be on the road, looking after these people. And these people's experience in the job is going to also help them to train new ones. So we're actually now using this to find jobs for our youths who don't have jobs to do. Because I'm sure if you know people out of this country, there are many of them who work on the emergency ambulance space. And that is a huge industry. And we just believe that we can galvanize and let people start changing the thoughts. There are categories of people who must train at various levels, work in ambulances, make sure they keep people alive from point of illness or point of ill health, or somebody's bleeding, get them well to the point where they can get to a hospital, and then the hospital takes over from there. So I actually see a big new industry. You would not 2-3 years ago see anybody who says I'm an emergency ambulance staff in Nigeria. But I'm hoping that in another year or two, you're going to see a lot of people who proudly say that this is the space in which they work.
Okay, let's go over to Dr. Dumbulua. And this is more or less a situation that recurs, plays over and over again in Nigeria. And I'm trying to find out how this will affect services, emergency services provided under NEMSAS. It's a known fact that you hardly have 6 months of industrial peace in so many sectors of the country. And the health sector is not left out. The country has had to contend with strikes and threats of strikes and lockouts. Even at very critical points in time, you find medical personnel down in tools, as they say. And this is a recurring problem in the country. How will this affect emergency services? We all know what happens when medical personnel go on strike. Hospitals turn back patients, people can't get enough care, and they're forced to go to private establishments where, well, if they can't afford it. So how are we going to put a stop to this? That when these contending issues of industrial harmony play out, how to insulate emergency services from them?
You know, usually medical emergency or medical services is something that is different. It has not actually an ordinary strike or protest is not supposed to affect it, but because of the cultural norms of Nigerians that we have now, it actually does. But what is important for you to note here is that when we are developing our manual, actually brainstorming to see what are the anticipating the potential challenges, we thought of the political instability. So we thought of what is called tax shifting. Tax shifting in a situation whereby doctors, when the doctors are not available, a nurse can do it, or a nurse is not available or adequate, then community health extension worker will do, and the issue of also the paramedics. So we're actually thinking, we're able to debate and see, okay, what is going to happen? Now, private sector will be available to actually come, because private sector will not go any kind of a political issues or issue of disharmony within the health sector in terms of working. So we felt that we leverage on the potentials of the private sector and also the issue of the tax shifting. And before I go further, let me just a little bit digress to actually add up to the issue of the ambulances that Global Fund is going to procure almost 80 ambulances to the Nigerian government. JICA, Japanese government, will also give us some ambulances which we are going to allocate. Rosevi is going to be one of the beneficiaries. And also in addition to the issue of the payment, which you've actually asked, the issue of the HMO and some other related issues. The payment of this kind of activity, or the payment fee for service, is going to be done through the TSA, and is going to be paid through the remitter platform by riding or integrating on the NHIS platform. There is no HMO, so to say, to actually in this type of a payment. It's going to be solely paid through the TSA using the remitter platform. However, it's going to pass through the state social health insurance scheme from the state and up to the national health insurance scheme. So, be as it may, we are very sure. We actually deliberated on it. We actually foresaw it coming, and we are sure that we have actually put things in place to make sure that when it comes, we'll actually wither the turbulence. And for sure, it's a new thing. It's a novel program. We anticipate many things to come, and as we're actually moving, then we get to actually come with solutions. But the coming of the private sector in this kind of engagement or the marriage, actually you see we're not likely to have this kind of problem that you are anticipating, so to say.
No one wants to have those problems. It's not a question of anticipating them. It just so happens that systems have a way of throwing up challenges. That's why sometimes when we do programs like this, we like to look at all aspects of it to see that there is a high state of preparedness for them. You did talk about rural areas and services, and especially riverine areas. And there we're looking at those ambulances, boat ambulances and the rest of them. I know they say you have to learn how to walk before you start running, but I'm also looking at a situation. Are you looking at air ambulances as well, as throwing those into this, because there are places, terrains that you may need those.
So let me start from the rural ambulance. At the moment, we have a typical example of the rural ambulance service that is in Takum, Taraba State, which is actually funded by the Theophilus Danjuma Foundation. It's very interesting if you go there. We are there with the Honourable Minister of Health and some other stakeholders. And we saw how it works. You see, you have a kick and a pep there in that Takum local government, and if you call a number there, the kick and a pep will move to that actually a ward to go and pick the patient and bring him to that very the hospital, and that person will be paid. You only pay 100 naira for you to actually to go to your area, to your ward, to collect you and bring you to the hospital. And after that payment, the TY Foundation is also actually supporting them by paying. So that's a typical kind of example of a rural ambulance ambulance service that is actually ongoing. And we also thought about the riverine, because you can just be, as far as the government is concerned, you cannot just come and say you're going to be providing ambulances, and then what about those people in the riverine area? There has to be, they must have their own boats. So the Global Fund also have indicated interest that they are also going to procure some boat ambulances for the riverine areas to ensure that this ambulance service actually is all over, and it actually gives the necessary services that is expected of the government to give, whether in the riverine area, whether in the rural area, hard to reach terrain area, and even the air ambulance, as the case may be, because we're going to sign MOU also with the people, private sector who are operating the ambulance, to see how people who can afford, because we can respond, we can facilitate, but we may not pay for some of the people for the air ambulance. If you're actually well-to-do, even if you're a retiree, but you are okay, or you're a consultant, and you have the money to pay, we can facilitate for you to mobilize the ambulance, you understand, air ambulance, to go and get it.
Yeah, well, I'm not looking at that because, you know, before it begins to seem like a service for the elite, I'm talking about ordinary folks who might be in a situation that you can't transport by road. Since this is what we're talking about, emergency services, I'm just asking if we're looking in that direction, especially given the situation the country is in today.
With the issue of the air ambulance, you know, this is, as I told you, it's a novel program. So we are starting first of all from the city. I'm actually going to the rural, and after rural, we also go to the riverine. You understand? And as we are moving, then we probably more funding will come, because the seed money is the only money that we have gotten from the government. However, when it becomes very transparent, you understand, people see they can track the money from point A to point B, and transparency is there, accountability is there. You know, there are many, you know, philanthropies, you know, development partners will bring money in that, you know, into the basket to see how we can actually promote that. But at the moment now, at the pilot, we're going to start in FCT. We're only going to do the real ambulance in the urban areas, and also we'll do the rural ambulance. Then when we move from one stage to another, then we go to the riverine, and we go to the stage of the actually starting to do air ambulance, because there is always a beginning of the beginning. If there is no beginning of the beginning, beginning will never begin.
Okay, at this point, we'll take a short break. When we return, we'll explore other aspects of NEMSAS, and hopefully the phone lines will be open, and you can get to be part of the discussion in the studio and bring in your other angles to this discussion on NTA Tuesday Live. So stay with us. We'll be back shortly.
To an opportunity at your own convenience. What if you stumble? Stumble into a friendly stranger and all you had to do is wave. What if? What if you unlock the opportunity of a lifetime with this new acquaintance in a branded shirt? What if all you have to do is your favorite things in your favorite places? Shopping at the mall, having a weekend getaway, or going to the movies? Your future is right outside your door. We are closer than you think.
Ever-busy ancient city of Onitsha is a commercial hub with millions of commuters seamlessly linking other states daily for business, leisure, and other purposes. To upscale its road network, the construction of a 1.6-kilometer long Second Niger Bridge, including a 10.3-kilometer highway furnished with other infrastructure, has been in motion by the federal government. This project will ease congestion on the existing 56-year-old Onitsha Bridge and boost the economic capacity of the state as it easily connects to other parts of the country. The completion of the world-class Second Niger Bridge Onitsha will be one of the many proud moments of the state, its people, Nigerians, and foreign investors. Onitsha, which hosts the largest market in Africa, is geared up to boast of an impressive road network. Once again, these moments are made alive by the federal government, and it is deserving of all the applause.
Tuesday Live, a network issue-oriented innovation talk show.
Thanks for staying with us. And this part of the program is where you can now join in the conversation in the studio. The numbers will be on your screens. We advise you to take advantage of those numbers and call in. However, we always say this every Tuesday. If you do call in and your call gets through to the studio, do us a favor, turn down the volume of your TV set so as to avoid the hurlback or the echo. And we also like to encourage you to go straight to the point. Don't bother too much about the greetings. Hello would be enough. Go straight to the point, keep it short, so others can get on the platform too and contribute to this discussion. So, welcome once again, and this part, we'll go straight to another of our reports. This one is by Ifoma Ndukoli.
The Emergency Medical Services was officially launched in 2017 in Abia State to provide out-of-hospital acute care and transport definitive care to patients with illnesses and injuries in cases of medical emergencies. Like the telehealth project and the geriatric health services, the Emergency Medical Services is one of the effective intervention health projects provided to the people at no cost. Under this new outreach, ambulances equipped with sophisticated healthcare gadgets fly around the 17 local government areas of the state, including the state capital, to rescue road accident victims and other patients with different categories of emergencies.
We handle emergency, both road traffic accidents, domestic accidents, even heart attacks that happen at home, hypoglycemic issues, and other medical emergencies. The aim of this program is actually to limit the damage of the golden hour. In medicine, what we call the golden hour is that time the accident happened or any injury occur. If you intervene early, the outcome is usually better. It has a positive impact on the actual mobility or mortality as regards the patient. If you delay, the patient will likely not do well. When we are called for an emergency, we arrive at the scene, we'll start treatment on site, stabilize the patient, and while we transfer the patient to the nearest hospital. We actually have some contact with the hospital that we do referral with.
Abia State Commissioner for Information listed the efforts made by the state government to ensure quick response to the accident scenes.
In the rural areas, through the cooperation of ASOPADEC, the Abia State Oil Producing Area Development Commission, we now have ambulances serving clusters of health centers. Then at the state capital, we have over 11 dedicated ambulances that supply different routes and take care of different categories of emergencies. So our EMS service is proactive, our EMS service is functional, and our EMS service is innovative.
As part of strategies to sustain the effectiveness of this new outreach, Abia State government say they have conducted series of trainings for bystanders such as the road safety and the fire service officials, as well as the paramedics, to equip them with the necessary knowledge to deal with cardiopulmonary resuscitation. Although the state government say they have not recorded any case of mortality since the launch of the emergency medical services, observers still believe that prompt response to emergency situation has been a major factor to resuscitating the victims and urge the people to always make quick use of the emergency numbers.
All right, straight to the phones. After that report, we go to Sebastian, who's calling in from Onitsha. Hello, Sebastian, go ahead.
What I want to tell you people is that I love what you people are doing. You understand? But the problem is not to say it. The issue is for the people that is concerned. Yeah, I'm talking to you, Mama. You are my namesake. Hello, I'm happy to hear from you. I'm calling from Onitsha.
Right, go ahead. Yeah, sure.
The problem we have in this country is not even to say. We have been hearing and hearing, but to do it is the issue. I'm now hearing about a ambulance. When the land one is not being working. Don't tell me now, it's embarrassing. I don't like that. Let's just start from the land one. okay, that's A1. Where are they flying to? Why can't we build a better country so that all those things will solve in this country?
All right.
I don't want to go too much. I'm very, very happy. So if they can say, as these people are doing it, if we can just maintain what they are saying, this country will be a better country. Thank you, sir.
All right. Thank you very much, Sebastian from Onitsha. Well, obviously, you would get a lot of that. People have been skeptical, not because they are born skeptics, but because of experiences of the past and programs come into effect and they're not, carried out the way they should. So all Sebastian is saying is, can action match words here?
Yes, exactly. I don't think that is only in the mind of Sebastian right now. I think most of the people looking at us, watching us in the studio, are wondering, is this going to actually come to reality? And I think there's a lot of willpower. The Honorable Minister of Health is leading this right from the front and is really, really keen to have this roll out in the FCT and then spread to other parts of the country very soon. So we believe that this is going to be one project that would actually make a lot of difference to our people, to the lives of our people. People keep getting ill and dying not because the problems are severe enough or serious enough, but because they don't get to care on time. Just to also correct a notion from Sebastian, who just called from Onitsha, that it's not anytime you get a patient into the air ambulance that the air ambulance has to leave the country. So even now, we do get people who are being evacuated from Lagos to Abuja and vice versa, and from the east up to Abuja, who are ill and they cannot travel by road. So there's already some movement of patients by air. But of course, like you said, that will probably be right now for those who can pay. One of the things that the NEPSAS project helps you to do is that you have a coordinated response. And remember that it's not all the time that people need to actually foot the bill of treatment for themselves. Let's say, God forbid, for instance, there's a building collapse. And it's in the news, it's right in the news, NTA flashes it, and people hear that there are 20 people who've been rescued. And some people could actually offer to airlift those kind of people within the country. What we're doing with NEPSAS is giving care within the country. You would find that some of these patients who need care might not be able to. There might not be the facilities to look after them in their state or their locality. Take, for instance, severe burns, things like that. Okay. And that facility may be available in another part of the country. And we should have the coordination, because part of what the NEPSAS approach is bringing on, and it's not just like you say in the report, okay. It's not that we've not had ambulances before, but there has to be national coordination where people know where the help can be when they don't have it. And we believe that in a while we'll be able to get to the point where we can lift citizens from one point to the other to get care.
All right, back to the phones now. We have a caller who's calling in from Akwa Ibom, Ubulum, I guess. Go ahead if you can hear us.
Yeah, my comment is this. Like the way I am working as an ambulance the driver, I enter work in the Ministry of Health. So the way they do emergency work, especially where I am now, for me, they are not responding to emergency case. So I feel the government should spearhead, should they take charge of emergency cases, responding to cases, not only when patients find it so difficult to bring cases to the hospital. So my suggestion is this: government can handle emergency cases on their own to fund the emergency section, including the drivers, the doctors, the nurses, people who are in that very area. So that is my own comment. So, and as such, they should properly take good care of them, different from the way other sectors are working, other health officers are working, so that it will help them to be very, very serious in their work. So that is my own comment.
All right.
They should be properly taken good care of, not like other health officers, like ranging from the driver, the nurses, doctors. That is my own case.
Okay, thank you very much. We'll ask Dr. Saidu Dumbulua to respond to that if you listen to the last caller.
To him, and he's very right. You know, when somebody actually tell you that, you have to agree, is right. And what is peculiar to this is that the Honourable Minister of Health is a kind of leader who is kind of tepid, tame and taciturn, and with a tenacity of purpose to actually to drive this. And he actually made it very clear, you know, even though there are a lot of skepticism around where people don't understand the concept, trying to say, look, the way this is going to operate is not going to be a normal, kind of a traditional response, where in the ministry, this is the way to do it, this is where other things, and the normal pattern of doing the bureaucratic pathway. We have to do it in a way that there's going to be a quick response, there's going to be actually a kind of adequate supplies of what is needed at a point in time, you understand, and also try to make an adequate awareness, campaign awareness, to make the people, the consumers, and also the providers to understand the peculiarity and the difference of this kind of emergency medical response. And I'm very much optimistic, because we do not have a spirit of failure, and we're very committed to do it, and we must do it, and we must do it together.
All right. Thank you. Back to the phones. We have Chibuike calling in from Abia, I believe. Chibuike, go ahead. Hello, are you there with us? Just turn down the volume of your TV so that I can hear the whirl back here. Oh dear. Hello, Chibuike.
Hello.
Yes, go ahead.
Hello.
Chibuike, if you can hear me, turn down the volume of your set. Hello, go right ahead now.
Okay. I'm very, very happy for the news I just heard. But I'm very happy for the news I just heard. I'm very, very happy for the news I just heard about the NEMSAS.
Okay.
So I'm thanking the federal government. But my question is, can I know the number I could call in other states?
Okay.
Like, is it happening now in other states?
Okay. All right.
What?
Straightforward question. You like to know the number, that's the emergency call number, and if it works in Abia State. Well, Dr. Dumbulua will speak about that, and also the Deputy Corps Marshal will talk about that as well.
All right. Thank you very much. Okay. Okay, you're the one talking.
Okay. Like I said earlier, there is the national emergency number, which is 112. It works on all the telecommunication networks, MTN, Glo, and so on. As long as you are in an environment where there is GSM network, you don't need to have credit on your phone, it works. And we also have the one that was established by the FRSC, which I said is 122. The 122 is, however, restricted to road emergencies. So you can call any of these numbers anywhere in Nigeria, and then you will be attended to.
So just to take it a little bit further, if you got a call from, let's say, within the FCT, Gwagwa Karimu, on a market day, what's the time of response that might take you to get there?
Oh, I told you that we have 11 ambulance points within the city. So if you talk of Gwagwa Karimu, we have an ambulance that will get there within 5 minutes. So whether it's on a market day or not does not matter, or any time of the day. These ambulances are there with the personnel. They do shift. So the ambulances are, at this point, it's not as if they are in the FRSC office, and when you call them, they will now move from the FRSC offices. No, they are right at critical locations along the roads within the city, and also the major highways that leads to the city. Then, as I said earlier, on the highways, we know where the black spots are. Black spots are places where crashes are occurring more frequently from time to time. So this is what informs the location of these ambulances along the highways. So we also have them there. And then this is in addition to the patrol vans that we have on the highways. The patrol vans are actually there for traffic management and law enforcement.
To you shortly. Let's just get this next call from Agi. He's calling in from Abuja here. Hello, go right ahead.
Hello, Mr. Suri. Thank you so much.
Yes.
This is a very laudable program and project. And we're looking forward to it really becoming a reality across board. Because your interview is there. Yeah, I know they are on tenured appointment. They look vibrant and okay to go with their project. Now, our problem normally is continuation. So I'm suggesting and advising that they should be able to lay down structures that can stand the test of time after they have left office, so that this project will not just die or after they have left or before they leave, because we need this in the country. Just like Dr. Wilder has said, many people have died because of just little attention that they will have gotten. And these ambulances will be to watch foreign films and movies. We see how ambulances respond. We would want to see that happen in the country, Nigeria. And I believe that many more lives will be saved from untimely death. So I give them kudos, and I pray that they are able to build structures that will last after their tenure and that will continue. And then Nigerians will be proud of them ever. Thank you so much.
Right. Thank you very much. As an observation he raised here, how sustainable will this project be? And again, it's one of the questions that you hear all the time. Projects begin, programs begin, and from one administration to another, from one chief executive to the other, it hardly continues. There's no plan or no plan that is sustainable. How would we describe NEMSAS?
Yes, that's a very interesting question. I don't know. It's the reality of how things are done in Nigeria, and I'm sure that the speaker is speaking from his experience of such laudable programs, and they tend to fizzle out in terms of their impact after some time. And it's sometimes because people would perceive the fact that those who led it initially have left the stage. We're doing all we can. Just yesterday when the MOU was signed, we also saw that the implementation manual was signed as well. That manual has actually become a very robust implementation document that takes into consideration some of these nuances of our environment. We're really hoping that this will be a sustainable endeavor, and there's been a roadmap which will be set that would allow other people to continue even when those who started are no longer there. But these are all fears that would usually be in the minds of Nigerians. We'll push it as much as we can. We'll do our best to make sure that there's continuity. And I think there are some aspects of this program that are novel. This is something that, I mean, if you think about it, if I was to give example from the telecommunications industry, it didn't end with that administration.
All right.
Because when it was sustainable from the point of view that people were paid for what they did. So even thereafter, people, you know, the telecoms operators just continue to be in business. Okay. So we're bringing that arm into this as well. This is a business. It is not completely and absolutely something that is done for free and government funded and it fizzles out. But we're creating a structure, and the 2014 National Health Act actually, you know, provides for 1% of the consolidated revenue of the country to fund this. So it is a structure that is sustainable.
Right.
Providers will be able to get paid for what they do. And once you are doing the business and you find that there's some money coming from it, we expect that you continue to provide care.
Right. Back to the phones. Ya'u calling in from Kebbi. Hello.
Hello. Good evening, sir.
Good evening.
Mr. Free.
Good evening.
Reaching to all our guests here that are talking of the importance of all these things of which all of us are now witnessing it. But I heard Lumbua talking about the number of the ambulances as well as the COP member and the whole, particularize everything to Abuja only. And in Abuja is one of the local government, is an area with only 6 local government within the 7 local government in the country, of which the other places, out of the 170 something or 200 million people are there from Lagos, Ibadan, the busiest way. And we have only one. When you come down from where the capital next to this junction, where the Federal Road Safety Commissioner are there with the ambulance, you will never experience one again, only inside Ibadan. And of the busiest way in Nigeria is that Lagos to Ibadan, through Sokoto or through Kaduna. And the black pot is talking about the COP member. We are having almost 17 to 18 black spots between the road. That is one. The other one is from Night Mile again, through Otupo, as well as going Makodi, last year through Nasarawa. So all these black spots are many in other places, and the ambulance are few in numbers. How are they going to get more ambulances to cater all these things? And they should at least know how to recruit some of the villages nearby their head partner to take care of all this, because it's a gigantic work with them. And we pray for Almighty Allah to guide them through all the undertaking they are to do, to give them a lot of wisdom and wit to control all these things. I know about the government established it, and it will now move forever and ever by God's grace. So thank you very much for. Thank you, Mr. Space.
All right, thank you very much, Ya'u. Straight away, DCM Kehinde Fanola will talk about that. You've raised issues of black spots and the number of ambulances, and also, after he does, Dr. Dumbulua will also comment on that.
Okay, thank you very much, Mr. Ya'u, if I got the name correctly, from Kebbi. You tried to identify the black spots, like I said earlier. We have them all over the place. But one other thing I also need to let our listeners know is that we, in addition to having our patrol vehicles and ambulances on the highways, we engage with communities that are on these major highways. We call it community responders programs. We train people, and then we equip them with GSM telephone lines with which they can make calls, and then we try to create a relationship between the communities and our offices along these major highways. Sometimes, especially very maybe early morning, in the early morning hours when crashes happen, you find that the villagers are the first to get to the scene of the crash. And when we have given them training, they have basic first aid training. We give them first aid bags, and we give them communication equipment that will enable them communicate with the nearest either ambulance point or a road safety facility. Then we're able to respond quickly, and then we get a lot of cooperation from the villagers. And sometime before we get there, actually, sometimes you see that they have even put the crash victims in a vehicle, and they know the nearest medical facility. Sometimes it may not even be a government, a public facility, but maybe a private facility. But because of the training that we have given them, they have ID card, they have reflective jackets. When they take crash victims to these village medical facilities, they receive them and then they are treated. And they know that whatever treatment has been given, the next of kin will come, and then the necessary payment will be done. And when they also call the nearest FRSC commands, they also make sure that they get to the hospital, get information from these crash victims so that they can call the family. This is part of what we do. We call the families or next of kin, as the case may be. Sometimes they cannot talk, but from their phones, you will see a contact that you can call, and then people will turn up at least to come and maybe make payments where necessary, and sometimes transfer the victim to bigger medical facilities when the need arises. So we are not relying solely on our ambulances and our patrol vehicles and our formations on the highways. We try to let the communities be involved. We engage them positively, and it is yielding results.
So we also asked Dr. Numbulua to respond because his comments are cut across.
I honestly understand his own frustration, so to say, and it is good for him to clear it, so that to be very clear, for him to understand that. Our target, we're actually very much focusing on the rural area, rural Nigeria, because in as much as we're not targeting the rural Nigeria, then for sure, the decimal indices, the narrative, you understand, will never change. So whatever you are doing, you understand, you must see the indices. After evaluating yourself, you'll see that the indices of the maternal mortality and morbidity change. If it's not going to change, then what is going to happen? Then the work done is zero. So basically, we are not actually focusing, say, we're Abuja or the elites. No, not to say, you understand? Because most of us actually were actually born and brought up from the ruralized settlement, receive rural education just out of nowhere. We are managed to be what we are, where we are now. So we are very much focused, you understand, and we are actually trying to target the rural people. And because in as much as we don't target the rural people, you understand, then certainly, then the aim is not even achieved, it's defeated. Because in line with the Mr. President administration of actually trying to actually impact and save the lives of the poor Nigerians, the vulnerable, the indigents, the elderly, you understand, majority of these people, the cohorts, they are from the rural Nigerian. They are not from the urban area, no, of the cities, you understand. In the cities, there are a lot of facilities. You see, the GDP is even higher. It's not the same as the rural area. Many other factors.
Yes, we will still return to you, but let's get this call in now. Ada calling in from Jos.
Yes, Ada calling from Jos, Plateau State.
Yes.
Very interesting topic. I say beginning to your guest there. You see, I don't know. Some people have said most of the things I wanted to say, but I want to say that this issue of ambulance emergency services, it should be addressed holistically. Starting from the driver to the medical staff and the rest of them, if they are properly motivated. Assuming they are owing the doctors or the nurses, how do you go about it? So these things are very important. Then again, there should be many ambulances, and they should be strategically located. I go abroad. I've had an experience before. Why they always get to the scene is that they have so many, and it's well equipped. When you get there, the doctor is there with them, the nurse, the staff, they're all inside that ambulance. Then it depends on what is wrong with you at that particular time when that accident happens. They will offer some medication, before rushing you to the hospital. So that's the problem we have. When you have only maybe 2 or 3 covering a long distance, that's the problem they have there. Then who maintains the ambulance? It has to be maintained. And it must always be in good shape. Every time it should be always good. Let it not become fire service. When they get to a point, they'll say they don't have water. I don't understand what they need. So that is it. That's why we are very pessimistic about the whole issue. It's not that we have wonderful ideas in Nigeria, but the problem is its implementation. And then when we say it's free, how free is it free? Because if you say people are not, if it's not embedded in the National Health Insurance Scheme or whatever, Who is the funding adequate? The hospitals where the ambulance is taking the person to, do they have drugs? You know, I mean, it's a whole lot. But all the same, let's not give up on this country. It's well.
All right. Thank you very much, Ada. From Jos, same issues that have been coming out all through this program. This particular one, I'm sure that Dr. Ogedegbe will speak about it, and also we'll go back to Dr. Seidu Dumbulua. But let's start with Dr. Ogedegbe. You heard Ada from Jos.
Yes, I heard the comments from Ada from Jos. And Ada, you've actually made some very important points there. So the emergency medical space is large. And I'll just take us back to, you know, some countries that have developed emergency medical service over time. They've kept improving. They didn't stop, you know, they didn't get to where they want to be at one day. So what happens is that once you start, you're going to start seeing a lot of holes that you need to plug. Ada has just asked, you've taken somebody to the hospital, do they have blood? Do they have what the patient needs? It's a monitoring process that will keep going on. Just to reemphasize that again, that this is a system where you're supposed to be incentivized to do more. You will take patients there and we'll find out how you have looked after them. So if you go to things like who maintains the vehicles and all that, where the NEMSAS framework is empowering organizations to provide healthcare, to provide emergency medical service. And these organizations will be paid for the service. So unlike, you know, the way that such scenes have been addressed in the past, government and the NEMSAS is not going to be buying ambulances and employing drivers and then building emergency care centers and things like that. No, we've not taken that approach. We are going to be using hospitals, and they will have guidelines in terms of what they need to put down to qualify in the first place. And because they know that when they qualify, they're going to see patients to look after, and they're going to be paid, they will invest more in the care. So we feel that it should be a self-sustaining system, self-improving system, where we also will be able to get feedbacks from patients who have been treated as well, who are able to tell the system to also know where the improvements are and what other things we need to do.
All right, there's another aspect of Ada's comments, but I'll just put it on hold for a while so we can get this call in from Gabriel, who's calling from Kanu. Gabriel, go ahead, and we'll return to Ada's earlier comments. Gabriel, go ahead.
Okay, good morning. Thank you for this wonderful topic you people are discussing. I think it's an interesting topic to all of us. I just want to have a concern because sometimes I do not understand. I had an incident from my friend's driver who died on the last day of 2021. He had an accident along Lugbe Kuchinkoro Road. So when the accident happened, it was a road safety personnel who happened to take him.
Gabriel? Hello, we're not hearing you. Hello, Gabriel? Oh dear. Oh dear. Gabriel, if you can hear me, can you just try to call back? Okay, Gabriel, please try to call back. We really need to hear what you have to say. The service just went off. That's a dropped call. Now that brings us to, you know, one of the challenges that we talked about, that telecommunication services must have to work in, you know, if you have an emergency system like this. Imagine if Gabriel were calling in for an emergency and that's it. You'd lose that call. And Dr. Dumbulua.
Now, first of all, is a response to Ada from Jos on the issue of payment for NHIS. What basically the NEMSA is going to be doing is that for the first 48 hours, NEMSA will be responsible, will pay for the services for the ambulance, pre-hospital treatment, and also the health facility treatment and care. But up to 48 hours, that person is going to roll over, you understand, to National Health Insurance Scheme. Under the National Health Insurance Scheme, that, you know, we have the 1% of the consolidated revenue that's been given to the health sector. 50% of the money has actually been given to the National Health Insurance to procure services, to procure health insurance. For who? For the indigents, vulnerables, and also downtrading who cannot afford to. So in view of that, people, by the time the person actually been brought to the accident emergency, being treated for at least stabilized for the first 48 hours, you understand, some will be discharged. If he's not going to be discharged, is he the type of person, depends on which state you are, you understand, is he the type of person who is qualified to actually be enrolled by that health insurance? If he's qualified as somebody who is indigent, actually handicapped, you know, elderly, and so on and so forth, then automatically the health insurance will actually continue with his own treatment and management. You understand? So, however, he is on the other side, that is very affluent, he's also okay, that he can pay for his own bills, then that he has to continue to pay for his own bills. So that is how the arrangement is all about.
Right, let's go over to Edo State. We have Timothy calling in. Timothy, go ahead.
Thank you. The project is a very commendable and a laudable one. My major concern here is the persons in the ambulance, the personnel in the ambulance. Who are these personnel? Because I know in civilized world, people who run, people who are in the ambulance that respond to emergency services are referred to as paramedics. So I don't know the people that are responding to emergencies in the hospital that you open now. I want to know the kind of personnel that are inside. What is their qualifications? Because somebody called earlier to say if they are currently they are going to be giving blood, the hospital, the emergency unit, they are going to be transferred to if they are well equipped. So I wanted to look into these issues because sometimes these cases happen and they are not attended to. Coming to the mobile phone to call, because I believe that there is no generalized number to call like that where an ambulance can respond to victims when these cases happen. So I want to also know if this call have been put through from the number that the FRS commercial personnel called out to the public. The person that picked this number, who directs, how do they channel the call? Do they channel the call direct to the ambulance service? Because I know emergency service system has a link. For instance, if it's a crisis situation where there is a rioting and there is a medical case inside the riot center, how do you channel this call? How do you link it? Because safety, police force, then the medical team at the same time responding to the same thing because there are multiple issues occurring at the same time. Okay. So how do you channel this issue?
Okay, Timothy, Dr. Ogedegbe will answer that straightforward.
Yes. So thanks for your call. What happens now is that, just as been said earlier, the emergency call centers are actually provided by the NCC, and they are operational in 24 states. However, you can get the NCC number from any part of the country right now. When you call this number now, so that is an emergency call, emergency number, the 112. When you call the number 112, you will get a response, and they will say, "What's the emergency?" At this time, if you say you've got, somebody attacking you or something like that, and you want the police intervention, that call is sent to the police. If there's fire, it's sent to the fire service. If it's a road crash or something like that, then it's sent to the FRSC. If you call 122, you also get a response from FRSC. However, if you then have a medical challenge, that is what the NEMSAS is coming to plug in. So that from that point, this call will be transferred to the medical response center. Okay. So what has been done now is that the memorandum of understanding has been signed, but it hasn't rolled out yet. In a few weeks, when it rolls out, first of all in the FCT and subsequently in other states, then that call, so we expect that in a few weeks, you'll be asked, where are you? If you're in the FCT, then there will already be operational in NEMSA system in the FCT, and you will get medical help. Okay. Right now, when you call the 112 and you have a medical challenge, they tend to tell you, ask you where the nearest hospital to you and try to guide you to find care. Okay. So the NEMSAS program is not yet operational in that sense.
Okay, right. Just to emphasize that sometimes from an emergency call there might be need for multiple approaches. For instance, you have a fire incident and you have people who are injured. You might also need the fire service and need medical services at the same time.
That is correct, Cyril. Yes.
Same thing when it's a crime scene. Some people have been attacked. You need the police.
Absolutely.
Of course, definitely.
And you need the ambulances as well.
You need the ambulances as well. So
that is correct.
all these are rolled into one. And it's assumed that those manning the call center are highly trained to know what to do in emergencies, because sometimes people might call in an emergency and they are very... it's likely they might not be very coherent.
That's correct.
And so you have trained people who are able to. Sometimes you can have children who call in, and so these are highly trained people.
Absolutely.
But again, back to some of the issues raised by the callers. It means that telecommunication services must be better than they are at this point in time. Another issue that was raised was the welfare. I think it was Adda who called in and talked about welfare of the personnel. Of course, Dr. Ogedegbe has explained who will be in charge of what. It's not the Emergency Medical Treatment Committee that's directly recruiting people who are going to man these services. But again, it's all part of the whole system, and people are raising concerns about how this system will work. On the other hand, the road safety also, responses have been for the time being fairly adequate, but like one caller, Yahoo, stated, there are many, many things that they still need to do. So as we begin to wind down here, we will ask our guests to address some of these issues that have been raised, including the matter of public enlightenment. And this is essential for the public that will be the beneficiary of these services to know exactly what to do and when and how to get those services. So let's start with DCM operations. Joshua Kainde Fanola.
My take on this is that we implore members of the public to be safety conscious, because when we talk about emergency, the response of people around who are conscious, who have seen what has happened, can make a difference between life and death. We are appealing to people that it costs nothing. You don't need to have credit on your phone. Once there is a crash or there is emergency that requires that you make a call, please don't be discouraged. Just call 112. It works. And in every part of Nigeria, you are going to get a response. Whether it is armed robbery, it is road accident, it is building collapse, or any form of emergency, please call 112. Then explain briefly and in very clear language. If you cannot speak English, speak Pidgin. If you cannot speak any of the Nigerian languages, there will be somebody there who will be able to listen to you, and then the message will be conveyed to the appropriate agency that will respond. I want us to believe it. It is working, and but the system requires the average Nigerian to make the system work. When there's a crash or somebody has just collapsed, it is not that person that is going to make the call. It is the people that are around that will make the call. And if you don't believe in the system, then it will not work. So I want people to know that apart from FRSC, government has put these emergency services in place. It is for us to make use of it. It is working, and we are part of what will make it work. That is people around making the call and explaining what has happened to the people in the call center, and they will take it up from there.
We raise the issue of public enlightenment because these days, what should actually aid us in calling for emergency help, the smartphones, have become a distraction. You have a problem somewhere and people are busy taking pictures to post on the on social media while people need help. We've seen it happen so many times. Accident victims are groaning in pains, and people are just filming and sending to the social media to be in order to say, I got it first. That's why we're raising this question of public enlightenment. Dr. Dumbulua.
Me, I can say that NEMSAS were committed to ensure that it is off the status quo from the table, that we must make the change, and the change and that would lead the total kind of changing the trend, the narrative of this dismal indices that is actually becoming so embarrassing to us. You understand? So to say that provided that the funds that we have is something that is statutory, every month it drops, and it is perpetual, it's not a regular budget, then we are very optimistic that it's going to be sustained. And soon, in the next couple of weeks, when it is rolled out in the FCT as a pilot, then you will see that, yes, for sure, this is going to happen. We are very optimistic, and we do not have a spirit of failure. And we are, God willing, which you all support, once again, we are going to make it happen, to save the lives of the poor Nigerians, which is a task for all of us to do. Thank you very much.
And Dr. Felix Ogedigwe.
Yes, I would just say that this is a project for Nigerians. This is a project that everybody has a very big role to play, and you've mentioned some of them already. On the concept side, we're very, very eager to make this work, and we're throwing all our support. And this is a project that brings the government, healthcare services, and the private sector all into play in trying to provide emergency medical service for Nigerians. But Nigerians ourselves have a lot of role to play. You do know, like just like you said, if you witness something wrong happening to somebody, your duty, your duty as a Nigerian, as a citizen, is not to take pictures. Your duty is to call for help. And you call for help. Now you know that there's the emergency number, and there are many more ways that you can call for help. If you see an ambulance conveying somebody who is wounded or who is sick, and whether there's gridlock or there's not, your duty as a commuter in the Nigerian road is to make way for the ambulance. We must begin to respect ambulance services. We must begin to do everything that we can do to actually push them, because who knows, and it's happened before, that somebody who's blocking the road for an ambulance, it was his relative that was in the ambulance. Yeah, so absolutely. So we now have to start understanding that ambulances are no longer services that take dead bodies. These are human beings who we're trying to make alive and trying to keep alive, and so we have to play our roles. And for those of us who work in the emergency medical services space, we must understand that this is a call to duty. This is something that is paramount. Just like you mentioned before, what will happen if there's a strike? We don't expect emergency medical services to go on strike. So people who are called, who have the calling to work in this space, must understand that lives are involved, and the emergencies are those that need prompt diagnosis and treatment. You have to treat quickly. They are time-bound. The golden hour has been mentioned. So all hands are on deck whenever anything goes wrong with a human being. The way you respect the life of a person is the way your own life will be respected. So all hands will be on deck to provide emergency medical service, to do the bit that we can to make sure that this succeeds, and make sure that we reverse these poor indices where we have the worst infant mortality rate in the world, the worst maternal mortality rate in the world because the women cannot get to care quickly, and the worst road traffic accident mortality rates in the world. We have to work to reverse this.
Now, as a final recap, this whole system is set to go into operation in a few weeks' time. That's what you've just said.
That's correct.
You're not giving a specific date, but you just expect in a few weeks the pilot will kick off first in the FCT.
That is correct.
Then from the FCT, expectedly it would move to other
states, yes.
Other states of the Federation, and it is expected that sometime within this year, you're looking at about how many states would have keyed into this?
So in the months that are left, in the next 9 to 10 months in this year, we're hoping, really hoping that we should have shown some presence in at least 1/3 of the states.
And this goes on.
And that goes on
until
subsequently.
there's full coverage.
Absolutely.
Urban, rural centers,
that's the goal.
The remotest village in Nigeria, we can confidently say that this service will get there.
By God's grace.
All right. We have to leave this conversation at this point here and thank our guests who have come in tonight to talk about emergency services, National Emergency Medical Services, and the ambulance system, Nouvelle. So we know this has not been in operation in Nigeria, but hopefully we'll begin to get one. So once again, we say thank you to Dr. Felix Ogedegbe, Chairman, National Emergency Medical Treatment Committee. Thank you for coming on NTA Tuesday Live.
Thank you very much for inviting me.
Dr. Seidu Ahmed Dumbulwa, National Program Manager, National Emergency Medical Service and Ambulance System, NEMSAS. Thank you very much for coming.
Mr. Sarah.
And Deputy Corps Marshal Joshua Kaine Fanola, DCM in charge of operations, Federal Road Safety Corps, FRSC. Thanks for coming.
Thanks for having us.
But in the next few months, we'll assess this program. We'll call you here to find out how well it's kicked off. Thank you.
Thank you.
And to all of you who joined us on this program, we'll say thank you for being with us. Next week, we'll be back with NTA Tuesday Live. I'm Cyril Stober. Continue to stay safe.
Hello and welcome. It's time for another interesting package of
Everything Music.
Angelina, you dey cool in my temperature. If you call, I go come deliver.
This is Stocky Movies.
In times of old, the world was full of wonder.
No!
Stop it! Welcoming you to your weekend for today.
It's time to use our voice.
Beyond Six Packs.
Bills.
Pay the bills, keep paying telephone bills. Pay my bills.
Welcome to Gallery.
Me and my parties.
London for what? London for medicine.
Medicine for what?
Medicine for coffee.
Are you sickness?
To our illness. Welcome to Gist Zone.
All right, my name is the Eselucien Wego One. Ona nyokoko nyonyo.
Did you get to see the way Daily Babadu pulls this? Don't forget to send in your messages.
There's a difference between picking, child, and issue. That is you can do more with less people.
If we have a better way of addressing these issues, taking care of.
Congratulations, you were able to sign Tilo Werner from RB Leipzig.
So you take water before your workout.
People have used their phone, using TikTok to do this like.
Should I go for test? Should I?
A lot of people don't even have resources.
I'm Cecil, and this is the Medley Show on NTA.
Disaster occurs on frequent basis. Some we hear of, others we do not. Terrorism, flood, fire, earthquake, car or plane crashes, building collapse, and even armed robbery, each bringing assets and revenue loss, human mortality, and in 90% of survivors, great loss of hope. Flooding is the most common of all environment hazards, and it regularly claims over 20,000 lives per year and adversely affects about 75 million people worldwide. Nigeria has had its fair share.
Who can say where the road goes, where the day flows, only time? And who can say if your love grows as your heart shows, only time?
Emergencies, as the name implies, are not set out to happen, but they can be planned or budgeted for. Disaster management may not avert emergency threats, but it will decrease the impact of disaster where well handled. It then brings to the fore the key phases to management of disaster: mitigation, response, recovery, preparedness, and prevention. Every citizen must be well acquainted with all of them. Wishing disaster away does not avert it. Rather, as put in the local parlance, a man of valor is only identified at a time of emergency. Let us always be prepared.
We want to talk about rights, there are obligations. I'm not saying that this government is a saint, it's very far from it. But there are things that we can do to make it better, and that's the challenge I'm throwing to you. You don't want to build this nation? I don't know where else you want to go. If I had a choice, I'll come back. When I stand outside and I hear what you have to say about this country that I know that I can die for as one, then I'm really sad because you're young. You have education. You have tools. You have a huge future ahead of you. And you're condemning yourself before you started on that journey. So please don't do that. Please don't.
This is the network service of the NTA.
Car accidents are scary, but a solo crash or a single vehicle accident is not just scary, but very confusing. Some blame it on bad weather conditions, sudden swerving to miss an animal or object that might be on the way, or even overspeeding. Oftentimes, the driver thinks it is a solo crash and does not feel at fault, with the thought that nothing could be done to avoid the accident. Or perhaps the enemies are at work. Is it really? Welcome to Road Matters. I am Fatima Umar. Solo crash is confusing but seriously on the increase, leading to serious injuries. We'll find out more in the course of this program today. A car somersaulted and led to the death of the driver. Getting into an accident that was fatal with no vehicles involved. As the accident spot is being cleared, questions run through. What could have happened for such an accident to occur? Was it the road, the driver, or a faulty car? The story was all over social media, and people came up with different reasons or angle to the crash, with eyewitness reports and people in shock over the accident.
At Abuja Facts tweeted, "Tragic news, a terrible accident involving a Ford Mustang with special number plates. Happened last night just before Life came roundabout. Driver, who was identified, was said to have died on the spot with his body and car shattered in pieces." At Newman Ashaka, he tweeted, "The owner of the car got into a deadly car accident along Kado Life Camp roundabout, and unfortunately, he had lost his life. Please retweet for anyone who knows him to see." God Save Nigeria tweeted, "I witnessed it too. This is the car after the accident, a total write-off. After seeing the accident, I was so shocked. The car scattered, the tires got burned from screeching, so you can imagine the speed." Replying to Newman Ashaka at Aeon, says they were having a car race with a friend and he lost control of his car. May his soul rest in peace and may Allah give the family the fortitude to bear the irreparable loss. I also learnt his wedding is coming up next month. Kemp said, "Since I saw Ford Mustang, I knew the man was a racer." Another tweet equally says, "Car literally split into two, legs dismembered, engine caught fire. Only top speed racing can give such impact." Dami tweeted, "This is serious, man. May God forgive the victims of their sins." Adbuchi of Earth tweeted, "Smashed into a tree. It was said that he was racing." At 0907 said, "I'm not being insensitive. Didn't he know he was endangering the life of other road users when he decided to race on public roads?" At Zamani official says, "Abuja boys need to start driving easy. Those roads are deadly." Mori Itohon equally said, "I wonder why they keep racing in this Abuja. It can be so scary to see. May God have mercy on his soul." Again said, "My dear, this shit happens every weekend." At Aeon says, "Bros, I wish just words like this will work. It's the norm here every weekend. Bass, boss." Ashaka is still saying, "I have seen a lot of accidents but never as ghastly as this. Subhana Allah. Ya Rab. Please take us when you are most satisfied with us and may we die a good death." Minister of Vibes and Enjoyment also says, "These days in Abuja, before leaving your home for the day, you have to pray against accidents. VIO, FRC, AMAC, NURTW, police, and others. Getting too much here." At Dan Kwambe tweeted, "Well, the question is, why do you have to be speeding to go to where? It was terrible." Aliyu Ibrahim says he was coming back from an occasion that his engine caught fire and he was unable to stop the car.
People come up with different reasons or angle to the crash. They feel that only the driver crashed the vehicle without colliding with other vehicles, or having any vehicle or driver close can make the driver think there could be other interference. Could it be so?
a lone accident, no other vehicle there, and you will be wondering why there will be such accidents. Sometimes it pains me a lot that we see accidents on very good roads. We know that we accuse our country of not having good roads, but how about where we have the good roads? We have good roads in places, and you will still see accidents. And these accidents are caused by several factors. Overspeeding can be one of them, drunkenness, and the improper state of the vehicle, the non-serviceability of the vehicle, and so many things are there that can cause accidents. And yet, these vehicles that have accidents, you will see a lot of religious inscriptions on them. Sometimes there are inscriptions that, God will save me, God is for me, God loves me, and all kinds of things. In fact, inside some vehicles, when accidents take place, you will see charms that some people have put inside the vehicle with the hope that the charm is going to protect them from dangers and things like that. So we believe that some people who have accidents, they have accidents simply because they believe some magical powers are going to be there to save them at the hour of the accident. And therefore, they drive carelessly and do not follow the law. I would say that from the teaching of the Word of God, the Bible says that everyone should be subject to authority. For there is no authority that is in place except that which God has established. And so we are supposed to be subject to authorities and to be respectful of authorities. Many people drive without even knowing road signs. They do not know speed limits because in a lot of places you have speed limits, you cannot go beyond this, and yet you see people speeding. A lot of people will get to what we call zebra crossing. Instead of them to slow down for the person on the zebra, because once a person is on that zebra line, a driver is supposed to stop for the commuter to be able to pass. But in Nigeria, they start blasting their horn at somebody on the zebra, and they are coming on top speed. They expect the person on the zebra to be the one to stop because they feel they have the right of way. And that is to show that they do not even know the laws of the driving. So, you see, we are breaking the laws from our ignorance of the law. And ignorance is no excuse when you break the law. We are breaking the law when we know that a vehicle is not serviceable, the tires are not good, some windscreens are so bad, the driver is not seeing the front, and when it is a time of rain, the wipers are not working well, people still keep on driving, and they drive with speed. And then when accidents happen, some people will just say, well, it's the work of God, it's God that allowed it to happen. That is not right. God has given us brains to reason. God is not going to come down to do many things for us that he has already given us the power to do. Yes, God will provide for us to be able to have food on our table, but God will not come and take the food and put it in our mouths. We have to use our mouths to put the food, and we have to be careful how we eat the food, because if we are not careful, we can overload ourselves with food, and it can become poison to our bodies and take our lives. So when we do that, we cannot say it is God that has taken our lives. We have been the ones not careful, and that's the reason why such a thing has happened. Therefore, people should stop blaming maybe somebody in the village, some witches, some wizards. They are after me. They do not want me to enjoy my life, and that's the reason I'm having accidents. Many accidents are caused by our carelessness. People will get to road signs, they will not obey. The traffic light will stop a person red. You will see a person going on top speed, even when the traffic light is stopping such a person. You know, somebody was sharing with me, he was riding on a motorcycle, and they got to the traffic lights, and the person was telling him, see red. And the motorcycle said, no, that the traffic lights are for vehicles, not for motorcycles. Can you imagine his understanding of the traffic lights? So many people beeped the light. And in Nigeria, people say red means stop, amber means get ready, and then green means go. But in proper driving, green is not go. Green is go if the road is free. Go if the road is free. If you see danger and you have green, you can't go simply because you have green. We are supposed to all work with our brains and ensure that there is safety on our roads. Therefore, it's not all deaths that we can say is God that caused it to happen. No. So many people die prematurely. People hit other people, take their lives unnecessarily. We ruin people because of our carelessness. And we should just obey the law.
I don't subscribe to many of those things. Some of those beliefs may not be accurate all the time. To say it is village people that made the car to crash or to have accident and things like that. There are so many other scientific ways of looking at it. The person may be depressed. He may be going through some problems. People need to investigate his life. What is he going through? How did it happen? Was he careless? Was he pressing his phone? Was he checking some mails? Or was he answering a phone while driving? Was he conscious of what he was doing? So did he just have quarrel with his family when he left, or is he rushing somewhere because he's trying to escape somebody he's owing? There are so many things, so many factors apart from village people. And people should not deny the fact that they are depressed. If you are depressed, it's better you seek medical attention. It's better you go for counseling so that your mind can be at rest. We should also understand that things happen in this world that we can't explain everything. But we must all the time have a sense of responsibility. We should hold ourselves accountable for many of the things that we do. So to say that it is village people that made the thing to happen to him, I do not subscribe to that. I believe that a human being can die, and Almighty God knows that we came to this world and we shall leave this world one day. What is most important is don't cause your own death by yourself, and to prevent whatever thing of mishap or accident is very, very paramount. However, some people believe that whatever will be, will be. Some people believe in destiny. Well, if you are not destined to die, you will not die. If you are not destined to be crippled, you will not be crippled. You are not destined to be knocked off by a fast-moving vehicle, it won't happen. Yes, we have the belief in destiny. But it's the same God who destined that if a moving vehicle should hit you, you will fall. And it's also God destined that if you hit your head on the ground, you will die. God also destined that if you kill somebody, even if it's accidental, you will pay. Because there is law. God has put the law in place. There's the law of humans, which we call constitution. There's also the law of nature, which states that some things can die. So long as you're a living being, you can also die. So a person has to approach the matter of safety, life, and destiny from two ways. You either fear God or you respect God. You have to choose one out of the two. I believe a person may have similar attitude to safety on the road. You should fear death or fear injury, and you should also respect life. Life of yours and life of others. You should also be afraid that you may lose everything you ever worked for just by being careless on the road. And God Almighty is not going to be held accountable for that, because He has given you the sense of justice. He has given you free will to choose. He has also given you a country or a place where there is law and order. Traffic lights, for instance, are there to guide us, to give room of road to other users, to know when to stop, when to pause, when to slow down, and when to move. Those rules and laws are there to protect life and property of yours and of others. And a person, no matter how faithful you are bound to respect this law and order that has been put in place, following the same law and order of Almighty God Himself. I believe humans didn't bring their law from planet Mars. It is from this earth that we get it, and we must understand that as believers, however much our belief is, we should understand that we have to respect the law and order, and we must protect our life and the property of other people, including ours too. So the thing is, don't kill yourself. The Quran says, "Wala talqu biaydikum ila tahluka." Never you put your hand into what can cause destruction. So if you put your hand into what causes destruction, you are going to be held accountable for it in the sight of God Almighty, in the sight of Allah. You are going to be asked about your life and how you lived it, and you are going to be asked concerning your responsibilities to others. So the maxim is that don't kill yourself, don't kill somebody else, and don't allow somebody else to kill you. Be conscious of the fact that life is sacred, and some people may have accidents, they may be lucky to die. But some people are so unlucky, they become incapacitated for life with so much pain and sorrow and regret of something they could have prevented within split of second. They now live with the consequences for the rest of their lives. That is even much more painful. The person you think is a co-road user, you think the person is in his senses. He may not be in his senses as at that period of time. The person may be thinking of a lot of things. The person may be absent-minded. The person may just be, experimenting with suicide or suicidal thoughts. Don't allow somebody else to commit suicide through you. And don't underestimate the fact that some people are really worried and disturbed. Some people are depressed. So when you use the road, consider the next person. In fact, when some people drive roughly for you on the road, just forgive them, because you don't know what situation they are into. Whatever it is, in your own case too, whatever problems you have, please leave them outside. By the time you are fastening your seatbelt, let it be that you've already kept your problem to one side. Don't go driving with too much on your mind, with too much on your head, and don't do multitasking when you are driving. You are changing the radio station, you are checking your phone, you are checking this one, you are just doing things like that are means of endangering your life and the life of others. If you are in a hurry going somewhere, take it to mind that haste and being in a hurry stops when you enter into your car, because you are not the only one that is using the road. If you are rushing to go and get money, well, you will buy somebody's car, and that same money will be used to fix the car of somebody else. Meaning that there are consequences for everything that we do. And we know very well, as far as destiny is concerned, nobody in history ever regretted being patient. People only get into regret because they are in a hurry or because they are impatient. So let us drive safely, let us drive cautiously.
It is a sad situation, and families are left grieving for no fault of theirs. Sometimes connecting it to village people. A local saying here when misfortunes happen. But are these village people to be blamed? If you do the right thing, will these village people still cause your unsafety on the road? I don't think so. Here are some tips. Distracted driving is a growing concern for most drivers. If you're distracted, you could drive off the road into a ditch. More distractions are available today than ever. Stop the distraction and concentrate on getting to your destination safely. Stay home when road conditions are unfavorable. Better to be safe than be late. Leave plenty of distance between your car and everyone else on the road to give yourself a safe distance. Sun glare can cause problems when driving, especially at dawn and dusk. Even if the sun is blinding you, you are responsible for your vehicle and safety at all times. Blaming the sun is not going to protect you from any form of accident. And always have sunglasses if necessary. Avoid potholes. Hitting a pothole will cause serious accident and damage. Cautiously swerve around potholes. Drive slowly over potholes. Be alert. Drive through high dare populated areas slowly. Mind the speed signs always. Solo crash is solo because you caused the accident, even though you might not understand it. So when behind the wheel, do stay alert for your safety. Do follow the program on the social media handle on Twitter at RoadMattersNTA or send a mail to roadmatters@nta.ng. Until the next episode, I am Fatima Omar. Be good on the road so the road can be good to you. Bye-bye.
Sitting is a natural thing to do as humans on a daily basis, whether in the office, at our various businesses, or while commuting from one point to another.
I sit 2 or 3 hours in my office, depending on the job I have on my table.
I do resume work by 9 o'clock, so 9 till 3. You'll be sitting either you do one patient job to another because we make dentures.
Sometimes when you're in the court, the court starts by 9, and sometimes the session takes up to 3 hours or 4 hours, and you sit through.
During the course of a day's activity, sitting is a must. While sitting itself is not bad, prolonged sitting, experts says, can shorten one's lifespan.
Sitting down makes you sedentary. When you're sedentary, that means that there's very little motion. You may say, after all, you're moving your hands and all that, but the human system is such that movement is supposed to circulate around all parts of the body, the blood system. And so when you are seated for too long, that motion, that circulation of blood is slow. And as it slows, it affects other functions of the body. Your brain, because the blood supply to your head is reduced. You even hear about people stroking in the office. They were seated and they just wanted to stand up and they stroke because blood hasn't circulated sufficiently to the brain. You know, it brings about cramps, arthritis, diabetes, even hypertension. And recently, to our surprise, it brings about mental problems. Because somebody that is sedentary, you're on the computer and you don't socialize, you become antisocial, so you're psychologically affected. So, I mean, the hazards of prolonged sitting cannot be overemphasized. Besides exercising at home before getting to work, while at work, I try, like I said, to be up every 45 minutes. If you look to the left side of my office there, you can see that my intercom, which is supposed to be in most organizations, people have it on their table, on their desk. You know, I don't have mine on my desk, not because I wouldn't want to, but it forces me each time it rings to stand up. You know, if you look around my mobile devices, my telephones, my iPad, you won't find them on my table, except I'm taking a call or maybe attending to a message. You know, each time it calls for attention, I have to stand up.
Prolonged sitting, especially in a wrong position, can also lead to brain damage, strained neck, back problems, muscle degeneration, hip problems, leg disorder, amongst others.
Hello and thanks for joining us on the news on NT International. I am Elizabeth Omori. The headlines. Nigeria to experience rainy season onset as early as February. Matters of security and governance take center stage as President Muhammadu Buhari receives Imo and Kogi governors. Plus, President Muhammadu Buhari forwards 2022 appropriation amendment to National Assembly. President Muhammadu Buhari is in Brussels ahead of the 6th EU-African Union Summit beginning on Thursday. Status correspondent Adamu Sambo has details.
President Muhammadu Buhari arrives Brussels International Airport at 10:30 Tuesday evening local time. On hand to accord him a befitting welcome was a delegation from the European Union and the Nigerian ambassador to Belgium, Obinna Onowu. Also at the airport were Ministers of Foreign Affairs and Health, Minister of State for Environment, the National Security Advisor, Chairman, Nigerians in Diaspora Commission, and other senior government officials. At the EU-Africa Union Summit beginning on Thursday, President Buhari is expected to join European and other African leaders as well as heads of multilateral organizations to discuss issues of mutual concerns.
In this instance, there are issues of sustainable and inclusive development, especially against the backdrop of the COVID devastation of the global economy. specifically for Nigeria and most of Africa, there are issues of unfair trade. Europeans, they subsidized their agriculture. And so therefore, there is no place when we try to break into their markets. It's always difficult to do because our prices of our own agricultural products are very uncompetitive here because of the huge subsidies, up to 50 billion euros that they give to their own, farmers. There's also the issue of the Economic Partnership Agreement, EPA, between Europe and African countries. All of the countries in West Africa have signed. Nigeria has refused to sign, maybe because we're a big economy, we're strong, we are the largest economy on the continent. It simply says it is unfair. And we are seeking that, look, let them put money and set up industries that will employ our people so that that desperation, to cross the dangerous waters and the deserts to come to Europe for better life can be ameliorated.
And on the margins of the summit, the Nigerian leader will hold bilateral engagement with other world leaders on areas of common interest.
There are not less than 7 or 8 foreign heads of state who have indicated their wish to meet President Muhammadu Buhari. Huge interest in our own country. And it is, of course, to discuss matters of development for us, investment, weapons purchases, and all of that. So we are hoping that there will be so much that we'll take from here. And the presence of our leader, President Muhammadu Buhari, is of greater significance, and it will help in a big way to push the national agenda of Nigeria at this meeting.
President Buhari is expected back in Nigeria on Saturday. From Brussels, Belgium, Adamu Sambo, NTA News.
Vice President Yemi Osinbajo was in Monrovia, Liberia, where he represented President Muhammadu Buhari at the formal launch of the year-long commemoration of the country's bicentennial anniversary. The Vice President, who joined other leaders across Africa and beyond to grace the event, was received by the Vice President of Liberia, Joel Taylor, and members of the Nigerian community. The Vice President also attended other events in Monrovia as part of the Liberian national celebrations. Liberia was founded in 1822 when freed black people started relocating to West Africa from the United States. On July 26, 1847, the country proclaimed its independence and became the Republic of Liberia. Vice President Yemi Osinbajo was accompanied on the trip by Minister of State Foreign Affairs, Ambassador Zubairu Dada, and Special Advisor to the President on Economic Matters, Dr. Adeyemi Dikpeolu. The Vice President has since returned to the country. In other news, OPEC Secretary General Mohamed Sanusi Barkindo has received a special award in recognition of his achievements as Secretary General of the organization for 2 tenures. Barkindo received the award in a high-level gala night hosted by Egypt Petroleum Show 2022, which is ongoing in Cairo. The Secretary General applauded the exemplary leadership and vision of Abdel Fattah el-Sisi, President of the Arab Republic of Egypt, and Tarek el-Molla, Minister of Petroleum and Mineral Resources. He congratulated them for successfully hosting the 5th edition of the event. Barkindo, whose tenure will wind up August, says it has been an honor of a lifetime for him to serve as OPEC Secretary General. The United Nations is deeply worried by the heightened tension and increased speculation about a potential military conflict in Europe as a result of escalating tension between Russia Federation and Ukraine. The United Nations Secretary General Antonio Guterres said this at a media stakeout in New York.
And my message is clear. There is no alternative to diplomacy. All issues, including the most intractable, can and must be addressed and resolved through diplomatic frameworks. It is my firm belief that this principle will prevail. The United Nations country team remains fully operational in the Ukraine. The time is now to defuse tensions and de-escalate actions on the ground. There is no place for incendiary rhetoric. Public statements should aim to reduce tensions, not inflame them.
From the United Nations Charter, Antonio Guterres said, the time to diffuse tensions and de-escalate actions on the ground is now.
The Charter clearly says, and I quote, all members shall settle their international disputes by peaceful means in such a manner that international peace and security and justice are not endangered. All members shall refrain in their international relations from the threat or use of force against the territorial integrity or political independence of any state or any other manner inconsistent with the purposes of the United Nations.
Russia says some of its troops have pulled back from near Ukraine, but NATO says no sign of de-escalation on the ground. Liberia marks 200 years anniversary amidst economic challenges as Kenyan teachers get up to 4 months of parental leave. Details with Obiageli Uwoke.
Liberia has commenced celebrations to commemorate its 200-year anniversary, the time when freed slaves from the U.S. first arrived their country 2 centuries ago. Reports say the U.S. established Liberia as an independent republic in 1847. Thousands of people gathered in the capital, Monrovia, led by President George Weah and a number of West African heads of states and people from the diaspora, mostly African Americans. Liberia's current economic frustrations under Mr. Weah's presidency prompted many people to demand the cancellation of the celebration. In other news, Ethiopia's parliament on Tuesday lifted the state of emergency imposed last November when Tigrayan rebels threatened to advance on the capital. The foreign ministry said the vote by lawmakers followed a proposal by Prime Minister Abiy Ahmed's cabinet last month to ease the state of emergency, which was initially supposed to last 6 months. The state of emergency was declared on November 2nd after fighters from the Tigray People's Liberation Front seized 2 crucial towns about 400 kilometers from Addis Ababa. In Kenya, teachers will now be entitled to up to 4 months of paid parental leave following an agreement with their government employer. Female teachers will get 220 days of maternity leave, while their male colleagues will be entitled to 3 weeks of paternity leave. This is an increase from the 3 months and 14 days that Kenyan female and male workers are respectively entitled to. Parents who adopted a child will be given 45 days of leave under the new agreement. Latest figure on global COVID-19 update shows the caseload currently stands at 414.7 million, with over 5 million fatalities, just as Nigeria confirms 75 new cases. Obiageli Ugoke, NTA News.
Thank you, Obiageli, for the updates. Connected Development, a non-governmental organization tracking the status of COVID-19 donations and its use in 10 African countries, has rated Nigeria highest in terms of transparency and accountability. This came from the Chief Executive, Connected Development, Hamzat Lawal, at a meeting with the leadership of the National Primary Healthcare Development Agency in Abuja. Oluseyi Adeagbo reports.
Donations both in cash and medical consumables have been coming to African countries, Nigeria inclusive, since the emergence of COVID-19. The management of these interventions and tracking them to as far as to the grassroots is the recent commitment of Connected Development Code, a group with a mission of empowering marginalized communities in Africa. The initiative tagged Follow the Money creates platforms for citizens of African countries to get informed while building their capacity on how to hold governments accountable. Future commitment was secured with a signing of Memorandum of Understanding between the two parties.
Today, Connected Development and Budget have now scaled into 10 African countries, adding Senegal and Zimbabwe. It's important that I stress and note that out of all the countries, Nigeria is still leading, because today we're about to sign a partnership that shows open government partnership.
These types of collaborations are what engenders trust between those who govern and those who are governed. For us at NPHCDA, all through the pandemic and all of the great work that has been done around COVID-19 vaccination, around the white polio virus eradication, we've always maintained transparency and openness in our business.
The partnership also aims at strategizing, such as scaling up of Nigeria's vaccination exercise, as well as engaging continued engagement between civil society groups and government agencies for better service delivery. In Abuja, Olusheye Adiagbo, NTA News.
Meanwhile, the Senate has advised the Presidential Steering Committee on COVID-19 to deploy technology in detecting fake test results before foreign trips. This is one of the positions of the Senate committee investigating alleged fake COVID-19 results in Nigeria. National Assembly correspondent Mobolaji Moribiri reports.
This hearing is sequel to adoption of a motion at Senate plenary over allegations that Ghanaian authorities have tested Nigerians who travel to their country positive for COVID-19, even after testing negative in Nigeria. Stakeholders on the subject matter took turns to intimate the committee on the journey so far on COVID-19 testing measures in Nigeria.
There are people who leave Nigeria who are determined and hell-bent on not following the protocol. They obtain fake results here, and therefore, when they arrive in other countries and they are tested, they can be positive.
The PSC in the last few months confiscated quite a number of international passports of some of the people that are found to have either violated some of these protocols, the PSC, NCDC, and of course they will go and work out a system that will leverage on technology that will eliminate the human error or what we are seeing in the system now.
Meanwhile, the committee also received submissions on 5 health-related bills aimed at improving the sector.
What we have inserted in it is that every hospital, public or private, shall receive for treatment with or without police clearance.
Give the eye hospital additional infrastructure and equipment so that they can increase the number of people that is served within that community and the environment.
This project will be one of your successful stories if established.
Much as these deals are desirable, we need to count the cost.
Both chambers of the National Assembly need to agree for the bills to be passed. From the National Assembly, Mobolaji Moribiri, NTA News.
Critical national issues, especially security of lives and property, dominated discussions as President Muhammadu Buhari granted audience to the governors of Kogi and Imo states. State House correspondent Adamu Sambo reports that Deputy Senate President and Deputy Speaker House of Representatives also came calling.
Both the governor of Kogi State, Yahya Bello, and his Imo State counterpart, Hope Uzodinma, met the president behind closed doors. Discussions held behind closed doors centered on efforts at enhancing the security of lives and property in their respective states.
Kogi State, as at the time I assumed office, used to be the most dangerous, let me put it that way, crime state before. But as at today, by the special grace of God, Kogi State is the safest state as far as Nigeria is concerned. Mr. President was very pleased, or is very pleased, about our performance in the state, in the area of security, economy, infrastructural development, integration, peace and unity that are being enjoyed in Kogi State today.
I had a very quality audience with Mr. President, and I used the opportunity also to make some requests that will assist us in ensuring that the security situation in Imo State is stable and that the fight against banditry is also sustained so that people can go about their businesses without fear of any molestation. In the same manner, I also use the opportunity to request Mr. President to consider locating a power generating facility in Warri River, where we have been able to empty all the flood control system by balloon technology, and the tide has gone up, and because of the sufficient water in the river now, we can use that river to generate electricity to serve the entire Owerri metropolis.
Governor Hope Uzodimma in particular used the opportunity to allay fears in some quarters regarding the conduct of the forthcoming National Convention of the governing APC.
APC is not a mushroom party. APC is a giant. It's the largest party today in Africa. And that is the party that other small parties should copy. Because all small parties come to do zoning, do that and that. Their internal mechanism must not be the same thing with that of APC. We shouldn't worry about little issues. I think our focus and attention should be towards having a workable democracy in Nigeria like we have shown, supporting government policies and programs, and then being patriotic.
The Kogi State Governor is more concerned about his presidential ambition, confirming, however, that the matter did not come up in his discussion with the President.
What is important now is the state of my state, the situation of my state, to give Mr. President that comfort of mind that as a governor, I am handling effectively and managing my state to the best of my ability within the limited resources, coupled with all the challenges. And what is important also is the stability of this country, and also to ensure that our party remains solid under President Muhammadu Buhari. Then thereafter, we shall come on board to announce to the world what our ambitions are.
President Muhammadu Buhari also received in audience Deputy Senate President Ovie Omo Agege and the Deputy Speaker of the House, Ahmed Idris Wase. Details of their discussions, also held behind closed doors, were not disclosed. From the State House, Adamu Sambo, NTA News.
You're watching the news on NTA International. Let's take a breather now. More reports ahead. To stay with us.
24 hours a day, 7 days a week. You can watch NTA International live on your TV, computer, iPad, tablet and phone. Log on to visiontv.co.uk and click on Entertainment, then NTAI. You can also download the iOS or Android app on your mobile devices to watch NTA International on the go, anywhere in the world. NTA International, your window to the world.
You're still watching the news on NTA International. President Muhammadu Buhari has forwarded to Senate the 2022 Appropriations Amendment proposal with a view to having a fiscal framework that will address the current realities. National Assembly correspondent Dayo Gunshola reports.
A letter from President Muhammadu Buhari requesting for amendment of the 2022 Appropriations Act to address current realities of the nation set the tone for Tuesday's Senate plenary.
However, following the suspension of the PMS subsidy removal, the 2022 budget framework has been revised to fully provide for PMS subsidy. An additional provision of 2.557 trillion naira will be required to fund the petroleum subsidy in 2022.
The President's letter seeks to repeal Clause 10 of the 2022 Appropriations Act, which authorizes the EFCC and the Nigerian Financial Intelligence Unit to charge from all monies standing in credit to units as revenue penalties or sanctions.
The Fiscal Responsibility Act 2007, as well as the Finance Act 2021, require that these agencies to remit fully any recovered funds to the Consolidated Revenue Fund. This course may lay a dangerous precedent and spark clamors for similar treatment by other anti-corruption agencies.
Another executive bill seeking to establish civil defense, correctional, federal fire, and immigration service board was also transmitted to National Assembly. Senate urged security agencies to curtail bandits' attack in the country. This is sequel to a personal explanation by Deputy Chief Whip on the upsurge of bandit attacks in Niger North. Senate this Tuesday passed Nigerian Safety Investigation Bureau Establishment Bill, sponsored by Senator Smata Adeyemi. 3 other bills passed second reading at plenary. They include a bill to establish National Institute for Education Planning and Administration, sponsored by Senator Ayo Akinyelure, a bill to establish Federal College of Education, Okobo, Akwa Ibom, sponsored by Senator Akoneti, and the one for an act to amend the Bank Employees Declaration of Assets, sponsored by Senator Sani Musa.
The bill, if passed to law, will, 1, provide enabling legal and legislative instrument required in the strategic operation activities of NEPA.
Quality teachers training is the sure foundation to achieving quality education in Nigeria.
To ensure that their lifestyle reflects their earnings and to discourage them from engaging in corrupt practices.
Plenary continues Wednesday. From the National Assembly, Dayo Nshola, NTA News.
Latest data by the National Bureau of Statistics show that inflation declined marginally in January 2022 after demand pressure pushed prices in December 2021. Statistician General of the Federation, Simon Harry, who released the figures, is optimistic the numbers will sustain decline in the year. Bossade Abel reports.
Inflation rate is one of the key macroeconomic variables like GDP, employment and unemployment exchange rates, among others. The first inflation data for the year 2022, which measured the price changes for goods and services, shows that consumer price index dropped marginally to 15.6% year-on-year from 15.63% recorded in December 2021, which is 0.87% higher.
On the state-by-state comparison, all items inflation on year-on-year basis was highest in Abuja, the Federal Capital Territory, with a figure of 18.59%, followed by Kogi, which had a figure of 18.28%, and Bauchi, 17.61%.
On a month-on-month basis, both urban and rural inflation recorded increases. Both inflation rose by 16.17% year-on-year in January. It was lower by 0.86 percentage points. On the other hand, rural inflation rate increased by 15.06% in January 2022, lower by 0.86 percentage points January 2022 inflation. The highest increases were recorded in prices of electricity, liquid fuel, wine, tobacco, spirit, solid fuels, cleaning, repair and hire of clothing, shoes and other footwear, other services not elsewhere classified, and pharmaceutical products. Bossade Abel, NTA News.
Now, the House of Representatives has received presidential requests seeking the establishment of a board for the Nigeria Security and Civil Defense Corps and some existing services. National Assembly correspondent Lami Ali reports.
2 executive bills, one seeking the establishment of a board for the Civil Defense Corps, Nigeria Immigration, the Fire Service and Correctional Service to adequately reflect the current relationship between the board, the Corps and these services, as well as another proposing amendments of the 2022 appropriation were read by the Speaker, Femi Gbajabiamila.
While hoping that this submission will receive the usual expeditious consideration of the House, please accept, Right Honourable Speaker, the assurances of my highest consideration. Yours sincerely, Muhammadu Buhari.
6 bills passed second reading, among them a bill to regulate activities of orphanage homes and a bill to establish Auctioneers Registration Council of Nigeria, sponsored by House Chief Whip.
Many of our government properties, it is through the instrumentality of auctioneers that these properties are being auctioned to the members of the general public. There is a need to regulate the practice of auctioneers.
Meanwhile, the House has condemned the brutal killing of DCP Abubakar Abdul Qadir and others by bandits during a rescue operation in Jibia, Katsina State, as raised by Kabir Al-Hassan.
Direct the police and DSS authorities to intensify investigation on the causes of such killings, identify the culprits, and initiate appropriate measures to bring them to book.
The motion from Emeka Martins urging authorities to investigate alleged invasion and destruction of property in Ahiazu local government area of Imo State by men suspected to be law enforcement agents was adopted. Representative Francis Charles Udiok's appeal for the reactivation of NTA Channel 35 Eket, Akwa Ibom State also received members' support.
The Nigerian Television Authority is the biggest television network in Nigeria, with stations in several parts of the country, and is widely viewed as the authentic voice of Nigerian government, with a mandate to unite and build the nation through its programs. The federal government commenced the building of NTA Channel 35 Eket, Akwa Ibom State in 2006, which was completed in 2008 and test run for commissioning in 2011, but was surprisingly abandoned on the eve of its commissioning.
The need to develop traditional herbal medicine through research was emphasized by the lawmakers when Representative Bashiru Ayinla brought up the matter during plenary. From the National Assembly, Lami Ali, NTA News.
Permanent Secretary, Ecological Project Office Habiba Lawa says 2015 till date has witnessed more commitment in the delivery of ecological projects approved by the Buhari administration across the 6 geopolitical zones of the country. She stated this when COS15 participants of the National Institute for Security Studies visited for knowledge seeking. Abdullah Ajia reports.
40 participants of COS15, led by the Deputy Commandants of the National Institute for Security Studies, as part of their training requirement, are visiting the Ecological Project Office to learn about the agency in connection with the thematic focus of their program, Global Climate Change, Prospects and Priorities for Economic Development and Conflict Resolutions in Africa. The interaction exposed the participants to how much government has shown commitment and consistency to addressing the challenges, utilizing the 1% Ecology and Derivation Fund to the benefit of Nigerians.
Effects of climate change are therefore widespread, affecting agriculture, energy, human health, terrestrial and marine ecosystems, water resources, and some industries across the world, most especially our continent.
Have local governments attending to local ecological problems and state governments attending to state ecological problems, then the federal level will just be complementary. And then the pressure that we have as the EPO handling projects into tunes of billions of naira wouldn't have been the case.
Climatic challenge across the world has to do with the ecology of the environment. So we wanted to have a forehand knowledge about the functions of the Ecological Project Office, and we are very satisfied with that.
The interaction also fielded questions on the milestone achievements, as well as project execution and operational functions of the Ecological Project Office under the supervision of the Secretary to the Governments of the Federation. Abdullah Hajia, NTA News.
The Nigerian Meteorological Agency has predicted that the country will experience early onset of rainy season this year, beginning from February 28. Let's now join Musa Aliu for more details of the prediction.
The 2022 seasonal rain prediction released by the Nigerian Meteorological Agency indicates that earliest onset of the planting season will occur in February in the coastal states, and is expected to last between 250 to 300 days. In the north central states, it was predicted that the onset of rainfall will occur between April and May, and eventually between June to July in the northern states. Minister of Aviation Hadi Sirika released the compilation of the seasonal prediction on behalf of NIMET.
The areas around Kwara, Oyo, Lagos, Nasarawa, Benue, Bayelsa, and Rivers, which are likely to experience shorter than normal length of growing season. However, prolonged length of growing season is anticipated in parts of Plateau, Kaduna, Edo, and of course, Imo.
Moderate dry spell for up to 15 days is predicted over parts of Adamawa, Ekiti, Kwara, Niger, FCT, Kaduna, Sokoto, Kebbi, and Gombe states.
The vagaries of weather and climate is not limited only to agriculture. Other socio-economic sectors have weather and climate as a very critical component. And that is why this document, SCP.
Predictions will not only help the aviation industry, the agri, even the insurance companies. In some parts of the world, you subscribe to the kind of information that is being given free by NIMET. And I hope that we all take seriously the seasonal prediction.
The country is projected to experience warmer days over the north and cooler nights around the south the month of March. The month of April is forecast to experience warmer daytime temperatures and cooler than long-term average nighttime temperatures. Musa Aliyu, NTA News.
Globally, countries that invest in science, technology, and innovation are the leading nations in terms of industrialization. This came up in a meeting between the management team of the National Space Research and Development Agency and key players in space technology. Adebola Brooksland reports.
Data published by the United Nations Statistics Division show that China, United States, Japan, Germany, and India are the top world's manufacturing superpower. A feat reached as a result of their huge investment in science and technology. This roundtable focuses its deliberation on the need for Nigeria to embrace space science and technology in order to tap the abundant opportunities inherent in it. Pioneer Director General of Nigeria's Space Agency, Senator Ajayi Borofis, is advocating better funding for the agency to acquire a ground station.
So if you have satellite in space and you cannot access it, it's useless. So it's a ground station that accesses the satellite in space. That's a connection.
It's like the engine that propels the space agency. That tells you the health of your satellite. It's also, you can hold the country to ransom because making data available starts with the ground station.
Senator Ajayi Borofis also visited Space TV, an online television station of the agency.
Space TV is going to help a lot. One, in educating Nigerians about the relevance of space to our economy. There's hardly any sector of the economy that space is not relevant.
The African Union's Agenda 2063 emphasized that Africa's development depends critically on science, technology, and innovation to be at par with developed world. Adebola Brooksland, NTA News.
Now, when you give women opportunities to contribute to conflict resolution and peace building, you will be amazed at the impact globally. This sums up the submissions of diverse speakers at the UN and Ministry of Women Affairs Peace and Security meeting in Abuja. Momso Damian Dati reports.
And indeed, our newish Foreign Secretary.
One of the reasons for the lack of sustainable peace and development in Nigeria and many other countries, according to UN report, is the inability of the system to harness and leverage the inherent potentials of women in contributing their quota to lasting peace-building processes. Addressing these challenges is the reason for this high-level stakeholders meeting at the instance of the Ministry of Women Affairs and the United Nations.
Percentage of representation of women in the security sector has come as low as less than 6%. Recruitment process, stringent requirement, which I don't expect them to compromise, but they need to give women some chances.
One of the main challenges that we have to address going forward is how these plans can be funded and how to also expand ownership of this plan. The Ministry of Women's Affairs has done a phenomenal job in really coordinating implementation of the plan. So it is up to all of the other government institutions and ministries to take ownership of this plan.
We have also about 8 law. The Women, Peace, Security agenda is to integrate gender perspective into peace and security endeavors. I'm Sudemian Dati, NTA News.
Time to take another break. To stay with us.
Experience unlimited super-fast internet access from Entel 4G. Entel. Live more.
Thanks for staying with us. Now to electoral matters. INEC Chairman Professor Mahmood Yakubu is meeting with resident electoral commissioners to ensure that no polling unit is without a voter. This becomes necessary in view of the experience in the FCT area council elections, where about 600 polling units were without voters, while others were congested.
While this lofty goal has been achieved in many states, there are still congested polling units with between 0 and 50 voters, as we saw in some of the recent elections. Over the next few weeks, the Commission will intensify efforts to address the issue ahead of the forthcoming Ekiti and Osun governorship elections and ultimately the 2023 general election. We will review and improve the functionality of the beavers for biometric accreditation of voters in the forthcoming by-elections and off-season governorship elections before the 2023 general election. The Commission remains convinced that the deployment of technology in our elections safeguards the integrity of the vote and provides a better guarantee for electoral credibility than the best manual process.
Minimizing discussions on what leaders of the People's Democratic Party described as acrimonious power rotation, but rather concentrating on building the party above other considerations, topped discussions when the party's leadership met with the party's stakeholders in Abuja. Timothy Yusuf reports.
It is a maiden meeting between the PDP NWC and leaders of the party in non-PDP governing states, mostly former governors and ministers. Former governor of Jigawa State, Sule Lamido, led the stakeholders.
No matter what you talk about power, you need the party first before the power. If the party is not properly organized, united and strong, power will elude us.
National chairman of the PDP, Yocha Ayuri, emphasized the unity now in the party as it works towards victories in future elections. He congratulated the party for its outing in the just concluded FCT area council's election and disclosed plans to challenge the election results in some council areas.
It is very clear that Nigerians are receiving our message. It is very clear that Nigerians want us back to power. And that is why in the FCT, they voted us massively back to power.
The NWC, Senator Ayu says, will employ consensus in running the party affairs, having been products of same consensus. Timothy Yusuf, NTA News.
One of the leading All Progressives Congress national chairmanship aspirant and former governor of Nasarawa State, Senator Umar Tanko Almakura, has commended the NTA for promoting Nigeria's interest through purposeful reportage. This was during a visit to the headquarters of the organization. Salute Guanara reports.
A handshake between two broadcasters, Senator Tanko Almakura and the Director General of the NTA, Yakubu Ibn Muhammad. While one is still active in the business, the other has since ventured into politics. On this occasion, NTA is hosting Senator Almakura, who visited to advance his political aspiration.
And I feel by this visit is an affirmation of the fact that no politician or anybody in any kind of endeavor that requires public attention could succeed without the help of the media. And of all the electronic medias that we have, I consider the NTA as the mainstream in-house with a large, wide range of viewership.
The Director General of NTA, Yakubu Ibn Mohammed, highlights the importance and influence of the media in a democratic society and pledged to support and promote every genuine democratic practices.
You have a media background, a strong media background, somebody who has a strong political background, which you very creditably displayed in your 8 years as governor of Nasarawa State, and now doing a very good job in the Senate. I think your credentials speak for themselves.
Meanwhile, Senator Almakura urged APC faithful not to relent in supporting the Governor Mallam Buni-led CECPC towards a hitch-free national convention.
But whatever delays or changes in the process before the convention to ensure that the convention is successful and seamless, I think all serious party followers and committed and responsible party members should be able to sympathize and appreciate.
Almakura is optimistic that the February 26, 20
make the rounds that President Muhammadu Buhari ordered that a query be issued to the Chief Executive Officer of the Nigerian Midstream and Downstream Petroleum Regulatory Authority over the importation of adulterated fuel into the country. An authoritative source in the presidency says nothing of such ever happened. The earlier story by a national daily paper credited to an unnamed source had said an angry President Buhari, who doubles as Minister of Petroleum, directed the Minister of State, Mr. Timbre Silva, to issue a query to Mr. Farouk Ahmed. The very competent presidency source, however, told correspondents covering the State House that was the utmost in the mind of the president was the restoration of smooth supply of quality petrol to Nigerians and not recriminations or blame game. The Nigerian National Petroleum Company Limited says over 2.3 billion litres of petrol will arrive the country between now and the end of February 2022. The Group Executive Director Downstream, Adeyemi Adetunji, who briefed journalists on efforts to restore normalcy in the supply chain, said the NNPC retail and stakeholders in the downstream will operate 24 hours. Lydia Sampson reports.
The queues are everywhere, including petrol stations right in front of the NNPC Limited, to mitigate the current fuel supply disruptions in many parts of the country, which was caused by the discovery and subsequent quarantine of methanol-blended cargoes of premium motor spirit, commonly referred to as petrol. The NNPC Limited has engaged stakeholders across the value chain.
This will restore sufficiency level above the national target of 30 days. As of today, NNPC has over 1 billion litres of petrol in stock, and the petrol being dispensed at the various filling stations in the country is safe.
He says in order to accelerate petrol distribution across the country, NNPC has commenced 24-hour operations at its depots and retail outlets. Similarly, Major Oil Marketers Association of Nigeria, MOMAN, the Depot Owners and Petroleum Product Marketers Association of Nigeria, DAPMAN, as well as Independent Petroleum Marketers Association of Nigeria, IPMAN, have commenced 24 hours loading and dispensing activities in some of their designated outlets. The NNPC has also constituted a monitoring team with the support of the Nigerian Midstream and Downstream Petroleum Regulatory Authority and other security agencies to ensure smooth distribution of petrol nationwide. In Abuja, Lydia Sampson, NTA News.
And as fuel scarcity continues to bite hard, interstate transport system in Kaduna metropolis has been epileptic, with new commercial vehicles plying the roads and charging exorbitant fares. This prompted some passengers to trek long distances. Dauda Mohammed reports that long queues in fuel stations are unprecedented.
The absence of usual ambience and chaos in some designated bus stops within Kaduna metropolis show that all is not well with the transport system, as passengers are stranded waiting for hours to join public commercial transport operating interstate services.
But this morning, I had to even beg to see somebody that will carry me for 150. I spent only almost 30 minutes on the road, no motor.
Reasons for that, most of them are on queues in fuel stations to buy premium motor spirit.
For days now, motorists in Kaduna have woken up to the reality of fuel queues.
Investigation shows that there is enough products in all fuel stations dispensing the commodity, but the chaos is as a result of some people with dubious motives to hijack fuel transactions to the black market.
People that are making things difficult, I don't need to tell you, you've seen it for yourself. They have their ways. We don't have our way, only to stay on the line.
The mass is suffering because of this. I feel that they should help us so that we will not suffer, because the common man is the one that is suffering.
While there is a fueling crisis in the interstate transport services, the situation also affects small and medium businesses in the metropolis. Dauda Mohammed, NTA News.
Time to take our last break. When we return, sports and other reports. North Korean ambassador to Nigeria, Jun Chung-chul, says educational bilateral agreement between Nigeria and Korean governments will promote new educational technology and ensure smooth transfer of technological innovation between the two countries. He made this known during his visit to the University of Abuja. Sulaiman Wahab reports.
For a country to stand and be called a developed country, experts posit it will need a collaboration of other countries. Therefore, the need for Nigeria and North Korea to come together in the area of science and technology will help both countries.
Korea and Nigeria, the two countries have a long-standing tradition of relations of friendship and cooperation. It is our consistent will to develop the bilateral ties to the next level.
The academia say promoting more technological innovation at the university level will go a long way in rapid socio-economic, political, and technological development of all the sectors of Nigerian economy.
We want the student to basically or ultimately learn on how to solve problems, as they continue to grow up as adults, and how to actually contribute their own quota in solving societal problems.
I have learned that for a country to build up itself, it can't stand alone.
His Excellency Comrade Kim Jong-il is to look at his good virtues. If you could recall, throughout his reign, he was bogged down by economic sanctions, propaganda, military intimidation, and so many other vices, but he was able to steer the country called Democratic People's Republic of Korea, or North Korea. It is now invincible.
The need to sustain ties between the two countries for the mutual benefits and all-round development of both countries was also emphasized. In Abuja, Suleiman Abdul Wahab, NTA News.
This is the second day of the 4 weeks warning strike declared by the Academic Staff Union of Universities, ASU. ASU President Professor Emmanuel Osedoke said the union is not going back on its decision until containing issues are resolved. Yingino John Adams reports.
Though the strike is still ongoing, ASU is still on deliberations
through congresses. President of the union, Professor Emmanuel Osodeke, says members are not going back on their decision until their demands are met.
We will not give up the strike. Let Nigerian people take up the struggle and tell the government to invest, as recommended by the World Organization, that Nigerians should invest above 15% of their budget to education.
Professor Osodeke reiterated that the action is for the interest of tertiary education in Nigeria.
What we are doing for the sisters, I'm speaking to you. If 95% of the students in Nigerian universities today are still in the public school, less than 5% are in the private school because of our struggle. Anytime we let down the struggle, your children and the children of Nigeria who earn 30,000 will be pushed out of the school.
As events unfold, it is expected that all parties involved will come to an agreement. In Lagos, Hinginu, John Adams, NTA News.
And next is Sports Update.
Of turning the tide against Jamaica and other world beaters in the world of athletics is the focus of the International Schools Athletics Championship scheduled for the 14th of March 2022 in Lagos. The brain behind the project, Nigeria's ex-international Nefiok Udo Obong, explained to journalists that the games is open to all secondary school students and individual athletes from ages 6 to 17.
We're going to treat them like Olympic athletes. We're going to treat them in competition venue. They're going to learn a lot of discipline and a lot of goal setting, because what we are going to have here is going to be a mini Olympics for children.
This golden generation, they have done their bit and they've left the stage. How about looking for the next ones? You know, that's what this is all about.
In football, the UEFA Champions League returns on Wednesday for the first leg of round of 16 matches. Salzburg takes on German champions Bayern Munich, while Inter Milan squares up against Liverpool. In golf, the second edition of the Nigeria and International Community Golf Tournament, which ended at the Ikoyi Club Lagos, was another opportunity to raise funds for charity by members of the club. Some Nigeria ex-internationals like former Super Eagles captain Segun Odegbami and Nigeria Olympic gold medalist Chioma Ajua were on the golf course to take part in the charity competition. Segun Odegbami won the tournament.
So what we're trying to do is to use this as a fulcrum to showcase the importance of helping the underprivileged.
In another development, ahead of the Commonwealth Games in Birmingham, the Nigeria Judo Federation is set to stage its national trials scheduled for the Teslim Balogun Stadium, Lagos, from the 22nd to 25th of February.
See, the first one is the trial itself. After that one, we are going to have what I call apparent representatives. Thereafter, in the 2-3 weeks there, I'll be able to select those that will really represent Nigeria.
It is expected that 28 judokas will be produced for Team Nigeria from the competition ahead of the Commonwealth Games. With Sports Update, Olumide Guntola, NTA News.
Now a look at the weather prospect for Nigeria and some cities around the world. And that's the news at this time on NTA International. Thank you so much for your time. Do remember to connect with us at the NTA. Stand Against Rape and Rapist. I'm Elizabeth Omori. See you in a few hours.
7 days a week. You can watch NTA International live on your TV, computer, iPad, tablet and phone. Log on to visiontv.co.uk and click on Entertainment, then NTAI. You can also download the iOS or Android app on your mobile devices to watch NTA International on the go, anywhere in the world. NTA International, your window to the world.
This vaccine is safe and it has been certified safe and usable by NAFTA.
This is the network service of the NTA.
Hi everyone, I'm Nnamdi Adigbo. Welcome to Insight. So a couple of weeks back, the executive chairman of the Federal Inland Revenue Service, Mohammed Nami, was elected as the 15th president of the Commonwealth Association of Tax Administrators, CATA, a group more popularly, of course, known as CATA, like I just said, for a 3-year tenure. On this episode, I would attempt to get some clarifications on the importance of Nigeria clinching a leading role in that association and, of course, use the opportunity to raise other issues on the national tax policy. I'd also delve into the issue of entrepreneurship for development, and that promises to be an enlightening session. Elizabeth Omori is still away, but she will be back presently, and we're sure to have her here next week. For now, let's get started. So why do we do taxes? Taxation is clearly one of the practical means of raising revenue to finance government spending on the goods and services that most of us demand. And while tax policies may vary from country to country, most regional and continental blocks have a coalition or, I would say, tax administration body that provides synergy and some sense of commonality on how to adjust a tax regime within a system for best results. Nigeria, of course, belongs to the Commonwealth Association of Tax Administrators. It's more popularly called CATA. And we just recently clinched a leadership role in that association. By the way, CATA was established in 1978 by a decision of the Commonwealth Finance Ministers. The organization helps member countries through conferences, training programs, publications, and knowledge sharing to develop effective tax administration that promotes sustainable development and good governance. I think that's enough for context and background, so let me introduce my guest proper now. His name is Michael Olufemi Olarinde, Technical Assistant on Tax Policy to the Executive Chairman, Federal Inland Revenue Service. Incidentally, he is also Nigeria's country correspondent to CATA. Welcome to Insight.
Thank you very much. I'm happy to be here.
So the Commonwealth Association of Tax Administrators is not a monetary unification in the core sense of it. And so I'm not sure that issues of commodity and capital tax coordination are fundamental subjects that you people discuss during conferences and trainings. I would, however, like to know how CATA factors in the harmonization of, how would I describe it now, distortionary effects of existing differences in national tax systems within Commonwealth member nations, all 47 countries at that.
So, if I may say something, thank you once more for having me. CATA, being an organization, of course, like you said, taxation varies from country to country. And taxation is actually about studying the features and characteristics of business activity within a location and trying to government taxing search with respect to the tax policies and tax legislation that are bound in such country. So, however, taxation is something that is, there's a uniform tax policy which every country tries to adopt. And so what are we looking at in CATA? We're looking at collaboration in tax administration. So irrespective of the differences in our different jurisdictions, the principle of taxation is one. And of course, every jurisdiction needs to conform with that basic principle of taxation. So, and world over, there's a move to convergence of principles, convergence of how you perform your functions in respect to tax administration. So we could say best practice. What is best practice? Though there's no definition for best practice, but we know what practice is good. And that is why the association needs to come together and study the peculiarities of each jurisdiction, and in order to have a common and uniform model of taxation within the member countries.
Uniform, you say. You've mentioned convergence, and that's quite striking. What's the benchmark if we're, like we've established already that regimes might vary from country to country, but there is a benchmark, you would say. What is it? What is our benchmark, especially for countries within CATA?
So when you talk about benchmark, of course, like we said, administration may vary from country to country, yes, depending on the business environment or tax environment,
yes,
and which is about the legislation that allows for taxation in such country. So now, you know, in taxation we have what we call the tripods of taxation, which you start from the tax policy, then you move to the tax legislation, and you go to the tax administration. Now, we know what is a good tax policy. So once you have your tax policy right, now you use that to develop your tax legislation before you now run your tax administration. Now, countries need to come together to now look at what is best as tax policy in every country. And of course, what is good in Nigeria is good in the UK, is good in the Bahamas, and is good everywhere. So you look at what we actually engender resource revenue mobilization within, and looking at the context. Of course, you are allowed to now adopt whatever decision has been taken to the peculiarity of your jurisdiction. So, like I said, convergence is you converge and you also present the peculiarity within your own jurisdiction. And because everybody at the table are experts, they'll be able to tailor whatever suits you. Having an omnibus decision that can actually cover everybody. That is just what the convergence seeks to achieve.
Forgive my naivety, but I don't know, you've mentioned something else that, I mean, that just stood out there. Good tax policy. What is a good tax policy?
Okay. So a good tax policy is the one that considers, number one, it considers getting revenue for government to fund public infrastructure, to fund the business of government.
Okay.
And also, a good tax policy must follow the principles of taxation, which means it should be simple, it should be fair, it should be equitable, it provides for equitable, that you ensure that people who earn more, pay more, and also that there's no disparity in the application of taxes. So that is what a good tax policy seeks to achieve.
We'll come back to this whole issue of good tax policy, and we'll pick certain elements of that you've mentioned here in the course of our conversation. But let me just return back to the issue of Qatar. I mean, at the level of Qatar, can you confirm that tax competition exists among member countries in a manner that promotes and engender pro-growth tax policies in member states? While you're answering that, please speak to the imports of Nigeria's current leadership of the association and the correlation between that and the issue of tax competition.
Okay, when you say tax competition, I'm sure you're trying to look at if a country tries to offer lower taxes in order to...
Especially within Qatar now, and how that balances out.
In order to encourage persons to shift their profit to one jurisdiction and the other. Okay, well, that is even one of the reasons why countries need to come together, so that you both look at your peculiarities, look at how to have the one that ensures that countries don't do that. And in the world over right now, you look at how you do your taxes, how you don't shortchange even your citizens, people who do your business in your jurisdiction. And if I may throw some light into Nigerian tax system.
Please.
Nigerian tax is what we call worldwide income. So irrespective of where you earn your income, you still have to pay your taxes in Nigeria if you are a Nigerian resident. So what it means is that even when you go to those countries and you do business there, once you come back home, you're still subject to taxation. So that's one. And when we come together as Qatar or as countries, we encourage to have what we call maybe a double taxation treaty, or you have a form of a treaty that allows credit of tax from one jurisdiction to the other, which means no country is still being shortchanged. So once you come together, those are the progressive discussion you have. And now going to Qatar, what it's a Nigerian presidency,
for our current leadership,
Nigeria right now. Right now, you, given your background to the issue of Qatar, you already said it's an association that ensures that countries tap from the knowledge of one another, also collaborate for effective tax administration, and also in innovation in tax administration. Right now, for Nigeria, let me just narrow it to the issue of the business environment right now. You know that we are moving from the era of brick and mortar in business activity and transactions, and now going to the electronic base. Digital. And what do you need? You need data. You need information to ensure, to be able to capture transactions, businesses. And in doing that, you need exchange of information, you need information sharing, you need data, you need even sharing of innovative ideas among members. And it is one of the essence of Qatar. It's actually to ensure collaboration among members and to ensure that they benefit from even knowledge of the advanced one. And there is a bias, or I would say there is a particular concentration on actually on the developing countries, trying to ensure that developing countries actually comes at par with the developed world. And it is one of the critical mandates of Qatar, and which has been done. So now, also you look at when you come to personnel training, capacity building for, of course, you cannot say that the capacity in the UK is same in Nigeria. So when you have a UK in the room, in an association with Nigeria, it is definitely that you're going to get some capacity upgraded, especially capacity of personnel. And over the years, I would say Nigeria have enjoyed some of the trainings at Qatar. When you talk about IFF, in illicit financial flows, it's an issue that has been a problem. And when you talk about it, it's not only when there's a fraud. Sometimes we have what we call the aggressive tax avoidance. And aggressive tax avoidance occur because maybe a particular a company or a firm have a cheaper way of doing business in another place, so it moves the profits from one jurisdiction to another. So if this is done, there is always the collaboration among members can help to ensure that the right jurisdiction gets what is fair, due and fair to them.
That's quite interesting. So I get the elaborate picture and synergy you've just painted here on Qatar's role and just how important it is for a country like Nigeria to be part, not just part of this body, but to actually lead this body. I understand for a 3-year tenure.
Yeah, it is for a 3-year tenure. Yeah.
Okay, great. Fantastic. I did say we would revisit the issue of some of the elements you mentioned while you were answering my question on what a good tax policy is. So I get the explanation that at a fundamental level, a tax system exists to allocate the cost of government in some fair way. But I would like for you to explain taxation from the angle of encouraging or discouraging certain types of behavior, or as a tool to correct market imperfections and to modify the distribution of income or wealth. Can you cite specific examples of how the Nigerian tax policy applies to each of the elements that I have mentioned? Perhaps begin with the one on modifying the distribution of income as well as taxation between the rich and the poor.
Okay, I'll strictly let me start from the basics. When you talk about, you're talking about trying to modify between the rich and the poor. Let me take, for example, what we call the personal income tax. Personal income tax is a tax which individuals pay on their income. So when an individual earns income, it pays tax. And in Nigeria presently, the personal income tax is paid to the states where the such person is resident. Now, how do you now use that to ensure that the one who earns more pay more? So we have what we call the table of tax rate. The table of tax rate now has a bracket. So your income bracket is dependent on your tax rate is dependent on your income bracket. So it is not one size fits all. So there's a percentage that you start from 7%. If your income is about 500, and then you move on to, so the last band is even higher, it's about 24%. So the income you earn determines how much you pay. So what it means is that government is collecting more from those that earn more and using it to fund for those that earn less. So, you know, when government collects that money across the board, you channel the same money to the provision of infrastructure. And this infrastructure will be used by everybody across the board. So I believe that's a way for redistributing income. Also, let me go to consumption tax, VAT. It's a known tax on consumption. So if you earn a minimum wage and you cannot afford, what you can just afford is to a cup of rice. Or let me say, because that's a basic food product, let me say you can afford a rubber shoe. That's a shoe made of rubber. So the price of such will be low. The price of such is low, and you pay the VAT under 5% of that particular amount. But if you earn let me say you earn 500,000 naira and you can afford to buy a Gucci shoe.
That was imported into the country.
That was imported into the country.
So you pay more VAT.
You pay more VAT.
So this applies typically when we talk about attempting to correct certain behavior.
Yes.
It aligns properly. Would you say we are fully exploiting personal income tax, and not just personal income tax, personal property tax as well, because they would seem to align in a manner that achieves satisfactory progressivity, meaning that a situation where the rich pay proportionately more taxes on the many properties that they own, and just as much as they earn. You know, use Abuja as a case in point for me, and use the issue of personal property to begin with.
Okay. Now, when you talk about you disagreeing with whether...
Yes, because why I tend to disagree, sorry for butting in again,
no problem.
Is because we have a massive informal sector in Nigeria, and part of the challenge that we do have is the lack of data. And to aggregate first off, to even aggregate what you amass as income tax from the generality of the population, you need to have a database that suggests or puts a figure to the number or how you're taxing. And this is a group, the informal sector is a group that is not, we do not have, do we have a database for the informal group in Nigeria?
Well,
so how do we tax a group that we do not have data on? I mean, please just help me clarify that. And of course, we'll come back to the issue and the question that I asked you about personal property tax as well.
So if I may start, maybe I should start from personal income tax. Now, when you say, what I just said is that you are a low-level income earner. Let me even say today, if you are earning minimum wage, now a government have said no tax. So don't pay tax if you are earning just the minimum wage.
That's 30,000 naira.
Yes, 30,000 naira or 360,000 naira in a year annually. So what I'm saying is that even at that you don't pay, but some people who earn more pays, and you still enjoy the same infrastructure. So it is a means of bridging